So hopefully we have recovered from yesterday's busy day. So today we'll have different programs, mostly focusing on panel discussion. So this morning we will start by discussing on Race of Hope in Africa panel. So our panel will be moderated by Gashao. Gashao Gabayo Welde is acting director of the Division of Africa in IAEA. So, where is Gashao? Okay, so until Gashao will join us because he was here, maybe he left. So I will call the panelists on the podium. Miss Fatima Hagar, Director, National Center Control Program at the Ministry of Health, Chad. Please, Miss Fatima. Come on the first floor. And the second panelist is Mr. Elias Meli, Chief Executive Officer, National Cancer Institute, Kenya, Ministry of Health, Kenya. Mr. Elias. Okay. That's our third panelist is Mr. Steve Muniza Kamunga, Commissioner General for Atomic Energy, Democratic Republic of Congo. And our next panelist is Mr. Noah Freeman Chimpan, Deputy Minister of Health, Malawi. Our other panelist is Ms. Nadia Yassin Dieng, Head Cancer Office Division of Non-Communicable Disease, Ministry of Health and Social Actions of Senegal. Other panelist is Mr. Malam Mustafa, Secretary General, High Authority of Atomic Energy of Niger. Ms. Kabelo Mupotse, Clinical Radiation Oncologist, Ministry of Health and Social Welfare of Lesotho. Ms. Toltlo Ralfala, Consultant Radiation Oncologist, Princess Marina Hospital, Botswana. And Ms. Hiot Solomon, Lead Executive Officer, Disease Prevention and Control from Federal Ministry of Health, Ethiopia. So these are our panelists. Mr. Gasho, the floor is yours.
Perfect. All good. Thank you.
Excellencies, colleagues, ladies and gentlemen. Good morning to all, and we are set to start our panel session this morning. My name is Gasha Wolde. I am the Acting Director for the Division for Africa, Department of Technical Cooperation, IAEA. I have the panel members across. Since at the start, their name has been mentioned by Dr. Lelisa, I may not repeat that. Over 70% of cancer deaths occur in low and middle income countries. According to the World Health Organization, more than 700,000 deaths occur in Africa in 2020. Cancer kills many people, particularly in Africa, due to lack of inadequate diagnosis and treatment facilities in most of our countries. Even though the assistance provided by IAEA has enabled many countries to establish and or strengthen safe, secure, and effective radiation medicine, more resources are required to bridge the gaps in equipment and human resources. The Race of Hope initiative was launched by IAEA Director General in February 2022 with an aim of assisting member states to improve access to quality cancer services using radiation medicine technologies. At present, 44 African member states have joined the Race of Hope initiative. The countries represented here as panelists are among the first and second wave of countries that have benefited from the Race of Hope assistance in terms of training, procurement of equipment, expert assistance, and other support services. They will share with us their progress, challenges, and successes achieved to date, as well as their plans to address the gap in terms of enhancing access to quality cancer care. Once again, I welcome you all to this session, and I thank the distinguished panelists for their willingness and readiness to share their experience and perspectives. My questions will be addressed within a maximum window of 5 minutes from each panelist. And the first question goes to Mrs. Fatima Hagar from Chad. Cancer is one of the major causes of death in Chad. Briefly describe the cancer situation in Chad with highlights on the number of deaths, number of patients, common types of cancer, mortality rates, and new cancer cases. Ms. Fatma, the floor is yours.
Thank you, Mr. Moderator. As I mentioned yesterday in Chad, cancer has been a silent crisis that's claimed many lives, overwhelming families that don't have many options to care. Until recently, we had no national data. Most figures were extrapolated from neighboring countries using models, mathematical models, making it difficult to plan effectively, and even more harder to convince decision makers not having our own data. But that has changed. In 2021, Chad established its very first population-based cancer registry. And in just 3 years, our cancer registry has become a full member of the African Cancer Registry Network and contributed to national data in the Global CAN 2022 for the very first time. We now have data to describe our own reality accurately, credibly, And for the first time, we can plan and act based on our own reality, our national situation, not using any assumptions or borrowed models. According to Global Can 2022, Chad has recorded 10,185 new cases, cancer cases, and 7,257 cancer-related deaths in 2022. These figures point to a very high mortality rate, largely driven by late diagnosis and limited access to care. The most common cancers in Chad reflect a mix of preventable, treatable, and infection-related diseases, such as cervical cancer, which is the leading cause of cancer death among women, followed by breast cancer. Among men, the most frequent cancers are prostate and liver cancers. Pediatric cancer, especially leukemia and lymphomas, are becoming increasingly visible, though still underdiagnosed. This data reflects an urgent reality. Many have shown that most of the common cancers in Chad are either preventable, treatable, and especially when detected early. Cervical and liver cancers are linked to HPV and hepatitis B, as you know, both preventable through vaccination. Breast and prostate cancers, when diagnosed early, also have excellent survival rates. The diagnostic landscape in Chad remains extremely limited. We only have one MRI machine for the entire country. Access to CT scans is limited both in geography and affordability, and pathology services are very limited as well, underdeveloped. There are very few labs, long diagnostic delays, and no immunohistochemistry capacity in most public labs. There are severe shortages of qualified personnel. And we only have one pathologist, Chadian national, and we have two expats working in the country. There's very few radiologists, medical imaging technologists, lab technicians are also in short supply. However, despite these constraints, change is underway. With the introduction of new diagnostic platforms, strong collaborations between labs, and growing awareness, we have seen a marked increase in cancer case detection over the past 2 years. But this is not just about infrastructure or statistics. What's changing is visibility and national traction in cancer care. We are no longer guessing, we're acting, and the data is speaking for itself. Today we have national data, and with the support of IAEA's Rays of Hope initiative, we are building a strong network of trained professionals. We've have a total of 24 health professionals that are being trained. And for the first time, we're developing a system designed for our own reality. We are still very early in our journey, but we are no longer standing still. And this is beginning, making traction. So we'd like to thank our partners for supporting us, and to others searching where to begin. We offer this message, even in the most challenging settings. Progress is achievable when countries are empowered to lead and resourced to grow. Thank you.
Thank you very much, Ms. Fatma. Now my second question goes to Mr. Elias Meli Kipchumba, who is the Chief Executive Officer of the National Cancer Institute of Kenya. Kenya is expanding cancer care services to other regions of the country. How has the NCCP shaped identification of priority needs under the Rays of Hope, and how has the Rays of Hope contributed to this expansion? Mr. Kipchumba, the floor is yours.
Thank you very much, our TC Director Africa. We really appreciate this opportunity to present in this third anniversary of Rays of Hope, and Kenya has immensely benefited from the support from IAEA over decades now, and this, together with other partners locally and internationally, has seen the cancer landscape in Kenya increase significantly. And over the last decade, there is so much investment that has gone into cancer care in our country, and commensurately there is also outputs and outcomes, and for those initiatives that were deployed much earlier, now we are seeing impact. And straight to your question, the Ministry of Health in Kenya has been very intentional, appreciating that cancer is the second leading cause of death in our country cumulatively, and therefore it poses a huge public health burden. So it's been very intentional that we have to have a clear plan on how to address this menace in our country. It not only causes physical, challenges, but social and economic impact as well when lives are lost and productivity is also lost. So as a country, there is so much over the last 10 years that we have noticed, and this has been due to best practices from regions that have done well. And the Cancer Prevention and Control Act, which was enacted 10 years ago in our country, has seen cancer being taken care of from a legal framework that then allows implementation. And through the entire continuum of care, the National Cancer Control Programming has crystallized into a National Cancer Control Strategy, which we are implementing, that runs through 5 pillars, which with the first pillar being prevention and early detection. We all appreciate that the only way we can win this battle against cancer is deploying more resources in prevention where we can, and screening for early diagnosis. Just like my colleague from Chad mentioned, cervical cancer is still a major challenge in our country, yet it's a purely preventable, purely treatable, curable, even at stage 3, stage 2, with very limited resources in our environment. Then investing more in prevention and early diagnosis would be better. And we have the second pillar, which is diagnostics, imaging, pathology, and laboratory medicine. The pillar of, treating cancer adequately is when we can make proper diagnostics. At this era of precision oncology, as a country, we have a lot of initiatives to improve our diagnostic capacity. And to mention, align with the support we've received from IAEA, there's been so much support in our nuclear medicine diagnostics program, as well as therapeutics, couple of, molecular imaging, including PET-CT scans in the country now are available for our patients. And we do appreciate that this improves then better staging, better follow-up for our patients in our pillars. Number 2, several MRI, CT scans, ultrasounds, X-rays are available, and we've had a lot of capacity building supported by IAEA. And into the third pillar, which is treatment with curative intention and palliative care, as well as those patients who get treated and get into survivorship. As a country, there's been so much, benefit. I am a practicing oncologist, and the patients I could treat 10 years ago are different from the patients I'm treating right now. I'm able to see, follow-up patients go into survivorship. It's one of my best moments when I see a patient who had presented, who would die, but because of the support capacity that the country with the partners has given, these patients now are being treated with cure. There are those who, unfortunately, though, still presents an advanced disease, and we unfortunately lose them. But there is better quality of life. Palliative care has now improved. Our fourth pillar is on why we are also here today, which have had being emphasized here on, innovative financing, coordination, partnerships. As a country, we've built so many partners that we're working together to deploy, and I see many of them here also that have supported our initiatives. You heard from yesterday, support from GE, from Electa, from Varian. I've seen Dr. Carlos from St. Jude's. We have had many activities in pediatric oncology, and WHO, and many other partners also within the country in professional societies. A lot has gone into that as well, and more resources coming in. And finally is on data, surveillance, registration, and research. Very important. Many of our patients in our country have been treated with foreign data. Right now, we have a robust national cancer registry that contributes into the 5 continents data under IAC, And we have had very robust population-based cancer registries as well as hospital-based cancer registries. This aligns very well. In strengthening our treatment arm, IAEA, under the Rays of Hope, has supported our country recently with 2 radiotherapy machines, which are high-end machines that would be found in any other high-income country, which then means there is more access now to radiation in our country, and more patients now, more than 70% of our patients would interact with radiation through their treatment, either with curative intent or palliative intent. And this adds to, 12 other regional cancer centers that we've expanded in the country. We've appreciated centralizing cancer care. Distance and cost of travel has been a challenge in our country. With an expansive country, there was an intentional decision, a policy decision from the Ministry of Health that we have to go into the rural parts of the countries. In the western, the northern, the eastern part of the country. Right now, we have a comprehensive cancer center, and IAEA, under the Rays of Hope, has really supported that initiative. Our patients can now access more care, less waiting time for radiotherapy, from 6 months to now under 1 month. That is tremendous, and we really appreciate. So much has really gone into improving, the outcomes of cancer care under the support of Rays of Hope. Thank you.
Thank you very much. My next question goes to Mr. Mwanza Steve from DRC. What are some of the challenges and gaps that DRC is facing in tackling cancer, and what strategies DRC taking to address the funding gaps identified?
Thank you. So in DRC, we are facing several challenges. So, for example, yesterday I mentioned already that we do have a challenge in terms of financial support for these projects. So there are money requested to our government, but as I mentioned, in 2024, none of that was executed. We reach out to international donors, like, for example, the OPEC Fund, and we are in advanced discussion with them. But even if we have the full support of this single organization, it will enable us only to arrange the field that I mentioned yesterday and to construct the 2 buildings for the radiotherapy and radiopharmacy. And that's not enough. We need the equipment as well, and we need the 3rd building for the higher school to train the technicians and engineer of the field. So we have started very early phase of discussion with the African Bank of Development, but here we do have an issue because we didn't, prior to that, discuss sufficiently with our Ministry of Health. And it's not very easy to integrate only the part regarding nuclear medicine and radiotherapy within the plan and the usage in place in the Ministry of Health. I guess other countries have known this difficulty. For us, we are just starting to find solution in this way. And according to a health expert from the African Bank of Development, this is somewhat a showstopper for them because they can only finance a comprehensive cancer center. And we only have part of this. We don't have surgery. Probably we won't have chemotherapy either, or other components for the patients like palliative cares and other supports. So this is one of the challenge. Of course, also the capacity of the people in charge is one of the challenge, but we have big help on this side by the IAEA. There is also a problem that for these new trainings, the people acquire a diploma that don't exist in DRC. And so there is also an effort by the higher education to try to fix this problem and to recognize these people when they return at the right level also of retribution, and in order to keep them and to avoid the brain drain. So these are, I guess, the main challenges we face. As I mentioned yesterday, the money from our government is also in tension because there is still this situation of war in the very eastern part of the country with two major cities occupied. So we hope that the current trend with international accords will enable the country to solve this problem. But as long as it's there is tension regarding the budget. So, yeah.
Thank you very much. Who is head of the Cancer Office, the Ministry of Health and Social Action of Senegal. Senegal is expanding its radiotherapy services. How has the impact reviews assisted in identifying the country's needs? And what are some of the successes achieved and challenges faced in enhancing cancer care in Senegal? Excuse me. I will repeat. Senegal is expanding its radiotherapy services. How has the impact reviews assisted in identifying the country's needs? And what are some of the successes achieved and challenges faced in enhancing cancer care in Senegal? The floor is yours, madame.
Merci beaucoup, monsieur le modérateur. Bonjour à tous les participants et nous remercions l'IAEA pour l'opportunité offerte au pays pour partager l'expérience du Sénégal dans la lutte contre le cancer en matière de renforcement de ses capacités. Et nous allons un peu mettre l'accent particulier sur le développement des services de radiothérapie. On sait tous que le cancer, c'est un problème de santé publique et le Sénégal n'est pas en reste. Avec les estimations du Globocan, on enregistre au moins 11 800 nouveaux cas par heure avec près de 8 000 décès. Et face à cette situation alarmante, le Sénégal s'est engagé dans une dynamique de renforcement de l'offre de soins en oncologie. Et dans ce cadre, on a été aidé par les missions Impact de l'IAEA en partenariat avec l'Organisation mondiale de la santé. Et ça a constitué un levier stratégique essentiel. Le dernier examen Impact a été conduit en 2020 et ça a permis d'évaluer de manière structurée toutes les forces et faiblesses du système de santé sur tout le continuum de soins, de la prévention aux soins palliatifs. Et les recommandations qui ont été issues de cette évaluation nous ont guidés dans l'élaboration du nouveau plan national de lutte contre le cancer, le renforcement de l'offre de services, notamment en radiothérapie, et la mobilisation de financement. Parmi les progrès que nous avons eu à enregistrer, nous pouvons citer la disponibilité actuelle du nouveau plan cancer national de lutte contre le cancer 2025-2029 et dont l'élaboration a tenu compte de toutes les recommandations de l'examen Impact, la mise en service d'accélérateurs linéaires, on en avait 3, 2 à l'hôpital d'Al-Diam, 1 à Le Dantec, et avec la fermeture de Le Dantec depuis 2022 qui est en rénovation, il y a aussi le service de Touba qui fonctionne et ça permet de favoriser l'accessibilité au traitement pour les patients qui doivent faire la radiothérapie. Nous avons aussi eu à créer le diplôme d'études spécialisées en radiothérapie et depuis sa création, il y a 18 spécialistes en radiothérapie qui ont été formés pour le Sénégal. Mais il faut dire qu'il y a la formation aussi des étudiants étrangers qui bénéficient des bourses de l'IAEA, qui sont formés. Actuellement, nous avons 23 en formation. Parmi eux, il y a 5 Sénégalais. Nous avons aussi une subvention de 700 millions $1 250 000 qui permet d'assurer la maintenance des équipements de radiothérapie et ça nous permet de subventionner le traitement par radiothérapie des patients pour une meilleure accessibilité financière. Nous avons aussi la formation de ressources humaines spécialisées à travers le réseau FRO en radiothérapie, en techniciens de radiothérapie, les physiciens médicaux. Et grâce au projet de coopération de l'IAEA, nous avons pu former 4 radiopharmaciens en France. Ils ont déjà fini leur formation, ils sont rentrés au pays. Il y a 3 physiciens médicaux qui sont en cours de formation et qui vont achever leur formation en fin d'année. Le reste des radiothérapeutes, les médecins nucléaires et les physiciens médicaux sont en attente d'identification de pays d'accueil. Je pense qu'incessamment, ils iront en formation. Nous avons pu aussi avoir, grâce à l'appui de l'IAEA, la dotation en équipement de médecine nucléaire, notamment le SPECT-CT et le cyclotron, et un comité a été mis en place pour la disponibilité et la mise en place et service de ces équipements qui vont contribuer fortement au renforcement de capacités nationales. Sinon aussi, nous mettons en œuvre des initiatives mondiales contre le cancer du col. Nous savons tous que c'est un cancer qui est évitable. Et de l'autre côté aussi, les initiatives mondiales dans la lutte contre le cancer de l'enfant, qui est un cancer hautement curable. Cependant, ce n'est pas que la radiothérapie sur laquelle on a noté des avancées. Nous avons aussi la disponibilité d'une subvention pour la chimiothérapie qui permet au gouvernement de rendre gratuite la chimiothérapie pour le cancer du sein et du col de l'utérus sur toutes les lignes de traitement et subventionner à hauteur de 60% pour les autres types de cancers. Ce dispositif quand même a permis de soulager la charge financière et d'améliorer l'adhésion au traitement, décentraliser l'offre de chimiothérapie dans au moins 6 régions du pays. Ces stratégies mises en place ont permis d'enregistrer des succès significatifs, parmi lesquels une meilleure accessibilité au traitement, une réduction des délais d'attente pour les patients et la construction en cours d'un centre national d'oncologie. Toutefois, malgré les progrès réalisés, il nous reste des défis importants, parmi lesquels la mise à niveau des services de radiothérapie, le renforcement continu des ressources humaines, la déconcentration de l'offre à tous les niveaux de la pyramide sanitaire. Donc c'est dans cette perspective que la collaboration avec l'IAEA à travers le réseau FRO et notre pays reste pleinement engagé dans une logique d'équité, de durabilité et de coopération internationale. Je voudrais terminer par réitérer nos remerciements à l'IAEA et à l'ensemble des partenaires techniques et financiers qui appuient le pays dans les soins pour permettre à nos patients d'avoir des soins de qualité dans le respect de leur dignité. Je vous remercie de votre attention.
Thank you very much for sharing us the remarkable journey of Senegal. And now my next question goes to Mr. Mala Mustafa of Niger. Niger has made good progress in establishing and expanding its radiotherapy services in the country, and describe briefly how Niger has been able to achieve this greater success since the launch of Race of Hope initiative in 2022. The floor is yours, sir.
Merci beaucoup. Bonjour à tout le monde. Au Niger, il y a eu beaucoup de progrès dans l'installation et la mise en fonction de la radiothérapie.
Le micro.
Oui. Ok. Merci beaucoup. Donc, avant de commencer à parler de la radiothérapie, je voulais juste faire une petite histoire et un petit historique de la collaboration du pays avec l'AIA, qui a vraiment beaucoup accompagné le pays pour le développement, dans le développement des activités de l'utilisation des techniques, sciences et techniques nucléaires dans presque tous les domaines. Donc, dans le domaine de la santé humaine, animale, la recherche, agriculture, hydraulique, mines, énergie, tout. Et nous remercions beaucoup l'AIA pour cet appui. Et donc, nous avions notre centre de radioprotection qui a été restructuré pour avoir une autorité de sûreté et régulation, régulation et sûreté nucléaire,
Et comme vous voyez, donc la HANIA, c'est la haute autorité nigérienne à l'énergie atomique qui a été créée en 2013-2014 et qui fait son chemin avec un programme national nucléaire dont l'électronucléaire, le programme électronucléaire pour développer l'énergie. Alors, pour parler maintenant de la lutte contre le cancer, avec un registre de cancer qui a été mis en place au Niger depuis les années 90, l'État a constaté, justement avec les techniciens, que le taux de cancer, la prévalence du cancer a augmenté beaucoup et il fallait prendre des dispositions pour la prise en charge. Le développement de la chimiothérapie, la radiothérapie, la chirurgie, tout. Et concernant donc la radiothérapie, le centre de lutte contre le cancer a été mis en place. Les décisions ont été prises depuis les années 2010, sinon un peu avant. Mais on a pris un peu de temps pour construire, équiper et commencer. Et la première activité de radiothérapie a commencé en 2021 avec le Cobalt 60. La machine avec son simulateur, ses accessoires, grâce à l'appui de l'AIEA qui a vraiment accompagné le Niger. Et récemment, ce plateau technique a été renforcé par le LINAC. Le LINAC, en octobre 2024, le DJJ de l'AIEA était au Niger pour l'inauguration. Et donc, nous avons ce plateau technique de radiothérapie avec Cobalt et Linac et aussi une unité de HDR et aussi en phase de finition sur son installation et sa mise en fonction. Il faut noter que dans cet appui de l'AIA, l'AIA a vraiment suivi depuis les activités de génie civil, la formation des ressources humaines, l'acquisition, l'installation des machines pour vraiment mettre en fonction le LINAC. Il faut noter aussi que le LINAC, l'accélérateur linéaire, donc, son acquisition, son installation avec la formation des ressources humaines a été réalisée grâce à une collaboration avec la BID et l'AIA. Il y avait les fonds BID qui étaient donc verrés au niveau de l'AIA qui nous a accompagnés pour l'acquisition des machines et l'installation pour commencer. Alors, nous avons une unité de radiothérapie fonctionnelle avec ces choses-là. Et en mars 2025, une mission conduite par le DG, M. Raphaël Mariano Grossi, avec ses collaborateurs, a été donc accueillie au Niger, avec accès complémentaire dans les sites, comme le Niger est un producteur de l'uranium. Ils ont visité le site de production, là où on appelle la Somaïre et la Cominac. Donc, pendant cette mission-là, le DG et sa délégation donc, ont visité le Centre national de lutte contre le cancer, surtout particulièrement l'installation du LINAC qui venait de commencer. J'étais très émerveillé quand même. Et aussi, voilà, ce LINAC, donc je disais, a bénéficié aussi donc des fonds de réseau Europe, les réseaux Europe, bon, les rayons de l'espoir. En perspective, nous avons toujours sur l'appui du réseau Europe qui accompagne le Niger, nous avons donc le projet de mettre en place un centre de PET-CT, un centre de positron. C'était couplé au cyclotron qui sera installé dans le grand hôpital, l'hôpital général de référence de Niamey, pour toujours améliorer la prise en charge du cancer, donc le diagnostic et le suivi. Et toujours en perspective, à partir de 2027, l'initiative du DG donc, va nous accompagner pour envisager la mise en place d'un service complet de médecine nucléaire et de radiothérapie dans une autre ville, la deuxième ville qui s'appelle Zender, pour ceux qui connaissent le Niger, et qui est environ à 1000 km de la capitale. Et ceci, vraiment pour faciliter l'accès des patients aux soins, un peu approcher vraiment les infrastructures au niveau de la population, puisqu'il y a des contrées qui sont très loin, il faut qu'ils se déplacent tout le temps, traverser 1000-1500 km pour venir à la capitale et se faire soigner. Donc il faut, on envisage de créer un autre centre pour vraiment approcher et leur faciliter l'accès. Donc, pour finir, vraiment, le Niger remercie et félicite l'agence pour son engagement constant auprès des États membres et l'encourage donc à poursuivre cette dynamique sur la mise en œuvre des projets nationaux et régionaux, très utiles pour le développement socio-économique. Aussi, nous encourageons les partenaires financiers à soutenir l'agence dans la mise en œuvre des initiatives du DG Grossi, et en particulier l'initiative Réseau Hope pour vraiment lutter contre ce fléau qu'est le cancer. Voilà les quelques réponses que je peux vous donner. Merci beaucoup. Voilà.
Thank you very much, Mr. Mustafa. My next question will take us to Mrs. Kabelo Muputse of Lesotho. Lesotho has started the construction of its first radiotherapy facility in Maseru. What strategies were used to secure government commitment and funding for training and construction of the radiotherapy facility? Madam, the floor is yours.
Thank you very much. Good morning, everyone. Strategies used to secure government commitment and funding for training and of the human resources and construction of the cancer center range from I don't know to what I can share as lessons learned from the road traveled. In 2009, 2010, the ambassador of Lesotho in Berlin was a medical doctor. He approached the IAEA, informed the country of this potential partnerships with the agency. Lesotho became a member of the IAEA in 2010. In 2011, we were able to have the first impact mission in Lesotho that produced a document which I used as a reference throughout my journey. The impact assessment mission document had recommendations, or first to say, yes, Lesotho needs a cancer center. There is a problem. In the nutshell, what the IAEA did through the impact mission was to help the country look at the cancer problem at BIM's eye view in terms of the radiation oncology terms. Looking at the problem, not while you are in the problem, but looking at it from the top and looking at what other elements are there. So with this, there was a bankable document that was produced, which helped bring the understanding on what is the economic burden of cancer. How can the country, even though we did not have a cancer registry, get to understand how to approach this problem, how big this problem was. Advocacy is difficult where there is no evidence, but with the information gathered from the Globocan, the WHO, we were able to use the impact mission reports to look at the problem and make the government understand. So it has really been persistent advocacy. At that time, I was not a specialist. I was just a medical doctor who was reading and understanding the problem from that point of view. We're able to align as the third strategy or the fourth strategy, to align the cancer problem with the national priorities. There was no cancer control plan, but there was the ministerial plan which mentioned NCD, promoting NCD prevention and management. At that time, it was in a draft form, so I just went in to type in the word cancer. Where there was NCDs, I would highlight cancer, NCDs, particularly cancer. So that's how the cancer was now infiltrated in the ministerial strategic plan. It was not an easy travel, but we were able to now engage with national manpower, national Ministry of Planning and National Development to understand cancer has become a problem, and as such, the National Manpower Development Secretariat should include training of human resources for management of cancer in the priorities for training. At that time, Lesotho managed to lobby for cost-shared training in radiation oncology, medical physicists, RTTs, nurses. But this is not, as I mentioned, this is not a blueprint. All this happened in the way, and we found ourselves to have now trained the human resource, no facility. This became also an advocacy tool to say, people have been trained. Can we not now have a facility so that they work in an established facility? So that called for budgetary advocacy to include the cancer now as part of to have a budget line for oncology matters. The minister who spoke yesterday, when he walked into office, he came to our facility to see what we do. We operate not with radiation because we do not have radiation. We send our patients to South Africa for radiation. But what we do in the clinic, he came to see, and he could not believe that the patients, the statistics we heard, are actually for the patients that we have. So he called that we should have a presentation at the cabinet. We were able to do that. We were able to present with the parliament to inform them of the problem and what can be done, still using the impact mission assessment. We were able to have the government secure funding for construction. For this year, $44 million is allocated for construction of a comprehensive cancer center that is in Lesotho. And at this meeting, the Race of Hope meeting, we have a delegation that is composed of the Minister of Health, Honorable Minister of Health, the parliamentarian chair who heads social cluster on health issues. We have our embassy in Ethiopia as part of the delegation, the deputy PS of Ministry of Health, and the director who manages the estates. We thank the IAEA in totality for the support they have had to the people of Lesotho to give them guidance on how to go and how to deal with this problem. I thank you very much, sir.
Thank you very much, Ms. Kabelo Moputswe. My next question will bring us back from Maseiro to Addis, and it goes to Mrs. Hiwoth Solomon of Ethiopia. Ethiopia is expanding access to cancer diagnosis and treatment. How does the National Cancer Control Plans align with the Race of Hope initiative? And what mechanisms are in place to ensure long-term sustainability of radiotherapy and cancer care services in Ethiopia?
Thank you so much, Mr. Moderator. Yeah, it's a very important question to share with you the progress so far and also the objective of cancer control program in Ethiopia, and that's really beautifully aligned with the IAEA and the Raise of Hope objective. Yeah, as you all know, it has major pillars considering to increase access and also to intensify the radiotherapy service, scaling up beyond the center service to the outreach of different parts of the country. And it has also important component in terms of assuring safety and quality as well as regulatory component of the service. In addition to in place the service, the human resource component is very critical, and we also give a good emphasis on HR development. And lastly, sustainability is very important, and it is also needs a good financial landscape to continue the service in sustainable manner. So these are some of the great pillars already considered under the National Cancer Control Plan. And just to give some brief information in terms of equity and access, previously we had only one radiotherapy center that's located in the capital, but on the first NNCP plan, it was to expand the service to other parts of the country, and the plan was to expand at least in 7, and we're almost approaching to achieve that target. So not only that, the other cancer screening and treatment service, I can mention some of them. As you know, cervical cancer is the top leading cause of women's cancer that really affecting many women in Ethiopia as well as in the globe. And considering this, previously we only have very few, in less than 100. That was really aligned with high burden areas with HIV prevalence. But now the scaling up of this service is really massively expand the last 2-3 years. Now we're able to have providing the service to the community in more than 1,500 health facility. That's mainly on the PHCU level, and this really helped downscaling of the service and also addressing more people by improving the access to the community level. The other example is in terms of considering the high cost of the treatment of cancer, the government of Ethiopia subsidized chemotherapy service, and up to 65% of chemotherapy treatment is subsidized by the government. In terms of budget, it's quite big. It's between 3 to 5 million USD annually we allocate to make applicable the service to our community. In addition, the expansion also goes very well with the chemotherapy center. Previously, we have very limited, less than 10, but now we can able to expand up to 33 sites providing chemotherapy and other service. In addition, it's very important to consider universal health coverage by providing comprehensive cancer service that's starting from the prevention, early treatment, screening, providing treatment, including the vaccination service. Yesterday, during the remarks, our top official also tried to share our experience in terms of providing HPV vaccine. It is one of the large number because more than 7 million girls are able to get the service within very short period of time. In addition, comprehensive cancer treatment and radiotherapy expansion. I already mentioned that previously, and with the second National Cancer Control Program, we consider palliative care. It was not really in place, but it's very important in terms of a better service, a better outcome, and we also work with other stakeholders in large to in place this service. Also, in terms of radiotherapy service, we are considering a safety and regulation, and in Ethiopia we do have Ethiopian radiation authority. Its mandate is to regulate and also to ensure the radiology service with international atomic energy guidance and all protocol. So these two line ministries are working very closely, and we are jointly plan and also make in place all the service to our community with the best service that's really considering the protection of our provider as well as the patient side, and this is also a good experience, and this is a part of the objective to ensure from Race of Hope directive. In addition, workforce development is very critical. As you know, cancer service really needs a quite long list of different cadres, and in terms of fulfilling this important workforce, with the support of IAEA and also in country with our university teaching hospital, we able to progress a lot, and in the future is also human resource development is under our second National Cancer Control Program document. So in this regard, we able to train radiologists, oncologists, technologists, nurse, and so on. The other important thing is having a good data and also up to the standard cancer registry. Previously, we only have one site that practicing this, but now we already consider the importance of having the standard cancer registry, population-based cancer documentation, and also using that information for next planning and so on. So Ministry of Health, together with other relevant stakeholders, working on that to intensify at least on all radio RRT centers in countries. That's at least in 5. Maybe early diagnosis is very important. We also use our health extension program at PHC level. We try to link different services by promoting and also increasing the community awareness in terms of cancer, because most of the guests, our cases are visit our health facility after already developing some stage, and that's not good also to have a good outcome after treatment. So we definitely sort out this is one of the community level problem, and to improve that early diagnosis and prevention component is really intensified, but still it needs much to work to improve in this regard. Maybe regarding sustainability, there are many elements to assure and also make in a very quality manner. One of the things is planning and budgeting. The good thing is our National Cancer Control Program is under the National Health Financing and also under the National Plan component, and it has already a budget and budget line under non-communicable disease, and that's really also get a good attention from the top level, and at political commitment it has a great support. As part of that, we able to get more than 25 million euros to make ensure the infrastructure development. This is apart from the construction. The other thing is a public infrastructure investment. Now to intensify a better service, particularly focusing on the tertiary level service. It has also have a good attention and is part of the plan. Also, multi-sectoral partnership and engagement with the line ministries, the other stakeholder and partner with international and local. This is one of the area to further intensify and implement. We also consider a very important element in terms of having this very valuable radiotherapy centers equipment. We need to have professional that really works on the maintenance and preventive maintenance as well in general the area of maintenance, so that we need human resource in this area. We don't have very few, but this is should be further improved, and this is one of the area for the sustainable cancer service. So the government is really very committed in the future, particularly with the new generation, the second generation of National Cancer Control Program. These are some of the elements are what elaborated further to work and also sustain our cancer service in Ethiopia. Thanks so much.
Thank you very much, Ms. Hiwat Solomon. My last panel question goes to Mrs. Tlotlo Ralefala of Botswana. Botswana opened her first public radiotherapy facility in the Sri Ketumile Masire Teaching Hospital in Gaborone. What measures are being taken by the government to sustain and enhance radiotherapy services in Botswana? The floor is yours, Madam.
Thank you, sir, for the opportunity to present a little bit about what's happening back home. Good morning, all. Just as a background, my government has really come a long way in ensuring access to quality cancer care for our population. Just in the early 2000s, we established our first chemotherapy unit in the public sector. Back then, we still had to send all our radiotherapy patients to the private sector in the country and also outside internationally just to access care. And all of this was at 100% direct cost to the government. Now, when I say 100% cost, I mean this was direct cost for treatment. So you can imagine a patient still had to at least find a way to get to a healthcare facility to access treatment. Clearly, this is not a sustainable model for healthcare delivery. But I'm happy to say we have since made strides working closely with the IAEA and other stakeholders back home to establish our first public radiotherapy unit, and this happened in 2023. So this spanned from having our impact reviews, technical support, of course. We developed bankable documents, roadmaps for establishing both radiotherapy and nuclear medicine in the country, as well as continued capacity building, which is still ongoing. Now, our facility is in the southern region of the country, our capital, Gaborone. Most of our cancer care is in Gaborone. This speaks to both private sector and public. We have multiple chemotherapy units. We have 2 other radiotherapy centers in the private sector, and we have a nuclear medicine facility, all of this offering care at different capacities. Of course, we're happy to see this happen. I mean, we came from not having everything to having a lot just now in one region. This clearly then posed challenges for our patients who stay very, very far. Just to put this in perspective, we have a country that's just slightly larger than France in terms of landmass, but we have a very small population. We were at about 2.4 million, but our people are spread across the whole country.
So at any given point in time, there's someone right now who has to travel 1,000 kilometers to get to Gaborone just to access treatment. But let's think about this practically. Who's going to leave their children back home? Who's going to leave their work in the environment and go stay in Gaborone for 7 weeks? And usually these are things that we have to be thinking of at the back of our minds when we are managing our patients. So based on some of this, while we, as I've said, very happy to have our unit, and we've ensured that we currently adhere to all the needful concerning our radiotherapy unit, continued capacity building, for instance, radiation protection protocols in place, service protocols in place. We, as a nation, envision way more than that. So what are we thinking? We are envisioning a radiotherapy service that's embedded in a comprehensive national cancer control plan. We're currently working with the IAEA and with the WHO, with IAC and other partners back home and internationally to develop our very first NCCP. Why do we think this is the way to go for us? I mean, systematic planning is practical. If there's anything you need to change, at least we can go back and say, do you think we can review this again? You know. But most importantly, it allows everyone in the country, in the cancer space, to know where they fit in. Oftentimes, there's a lot that's happening, especially when we start talking about public education. There's usually quite a lot happening. But if you don't have a system, if you don't have a systematic way of dealing with this, you find a lot of patients there, who are a lot of people in the population, potential patients, a healthcare system that's not ready for them yet, right? But we had to go the NCCP route to address some of these. And we also believe that this is a very powerful tool for negotiation anyway with our stakeholders, especially right now in a climate where we know there is multiple competing interests, not only just in the healthcare sector, but also elsewhere. So now what does this look like practically back home, you know? So firstly, sustained political will with universal healthcare coverage. Yesterday, my boss just mentioned that we now have to have health insurance for all citizens. There's often quite a lot of queues in the public sector. So if you want to have your screening done, or you have to have surgery done, all of this, there's quite a long waiting time. But if someone can at least have access to both public and private, it's way, way much better. Now there's financing and stewardship as our second one. We have intentionally ensured that cancer care is budgeted for in our country. And this also will secure continuity of care beyond donor timelines. And we also are looking at our data and system thinking. The main focus here would be to strengthen our national cancer registry. Currently, our data collection is still paper-based. There is not enough personnel to do that. So clearly then we know that there is multiple missed opportunities here. So we're looking at having a real-time electronic capturing of data. Our plans and everything we do are only as good as the data that we have. There's also primary health care revitalization back home. So we're going back to our communities. We want to hear their voices. We want to work with them. We will prevent what we can. We will diagnose early what we can and refer timelessly to the necessary facilities. There's also workforce retention and capacity building. We're looking at public-private partnerships model. At the moment, if you're in the public sector,
that's where you will work. If you are in private, then that's where you'll be. But, you know, to avoid brain drain, you know, brain drain, it's not only, it's just saying someone will leave the country, but, you know, someone can also just leave the public sector and go to private because it's way easier there, maybe, right? So now if you can work in both, it's way much, much better. And our patients can have access to excellent healthcare either way, right? And then we have to look at reviewing our salary structures, of course, but I do think the Triple P model can also help with this. We are continuing to train our people, and we're doing quite a lot with the IAEA, as well as partners back home, academia, for instance. Because I won't forget that we are also looking at decentralizing our radiotherapy services in the country, looking at establishing another public radiotherapy unit in the northern part of the country that will service our population in the north and the western part of the country. And really, this is to make sure that no one ever has to choose between life-saving treatment and whether they can leave their family behind or not, right? Now, we're also planning on leveraging on existing partnerships. We aim to learn a lot from those who've already gone ahead of us. We're thinking, can we leapfrog? We're thinking there's quite a lot of things that we don't need to duplicate. We don't have to reinvent the wheel, really, in quite a lot. And we can actually get a lot done far much more quicker. Yeah. So finally, with our approach, we aim to work closely with our nation and with all our partners to eliminate what we can. Imagine a world where there's no cervical cancer. Imagine a woman who doesn't lose her life to breast cancer. Imagine a man that's empowered to seek medical attention on time, and a child who can still go back to school and have a meaningful career despite having to have had whole brain radiation, for instance, or even just radiation to the brain. Let me say radiation to the brain. And imagine a place where the finance minister says, give them money. They say, if we can eliminate cervical cancer, we'll save more money, so you don't need to be treating quite a lot of people. Imagine being given all that, you know, buyback, right? And imagine a place where the lawyer is also involved in the whole process. Can we safeguard cancer care legally back home, right? So it doesn't have to depend on who is currently leading or not, but all patients can know they will always have access to the needful for cancer control. We definitely thank the IAEA and Race of Hope Partnership for working with us this journey, and we're looking forward to our sustained collaboration going forward. Thank you.
Thank you very much, Ms. Lotlo and all panelists. As we note, your answers shed light on the specificities of the challenges and the remarkable and unique experiences you had in the journey of promoting radiation medicine and enhancing cancer care in our countries. Participants, allow me to finalize our session in a few minutes. I'm sorry I might have a little bit overused. Bear with me again. I would like now to invite our esteemed donors and partners to take the floor and make their interventions or comments. And due to the limitation of time, please limit your interventions to a maximum of 3 minutes. And Israel has contributed to the Race of Hope initiative to help African countries to increase access to radiation medicine. Let me welcome His Excellency Dr. Abraham Nuguse, Israel Ambassador to Ethiopia, to make a short intervention. Excellency, the floor is yours.
Thank you. Director General Grossi and members of the delegation from the International Atomic Energy Agency, ambassadors, honorable dignitaries. I would like to start by expressing my sincere gratitude and appreciation to the International Atomic Energy Agency for the opportunity to take part in this important event on behalf of the State of Israel. The Rise of Hope initiative embodies long-term hope as it enables diverse forms of support from countries in need for cancer care, a service that remains critically required across the globe. As ambassador of the State of Israel to Ethiopia, I am deeply aware of the urgent need to address such diseases from both perspectives. On the one hand, through scientific and technology development. On the other, through sharing knowledge and expertise. The State of Israel attaches great importance to participating in the Rise of Hope initiative and has therefore been engaged in various forms, including financially, since its inception in February 2022. This engagement reflects our human and moral commitment to healing the sick, rooted in the Jewish value of Tikkun Olam. The aspiration to improve and uplift human life. Another central value, deeply embodied in Judaism, teaches us that whoever saves a single life is considered to have saved an entire world. This moral principle underlines the profound worth of every human life. The current reality, where the access of some countries to cancer care is severely limited or entirely absent, presents a genuine global challenge. Israel was among the first countries to join the initiative and sees great value in continued efforts to support its goals. As a nation that significantly invests in research, science, and innovation in cancer treatment, Israel sees great value in advancing and nurturing these efforts, including by expanding the potential for international research cooperation in the future. We see great importance in pursuing the Rise of Hope initiative with partners in Africa, as the State of Israel is in the midst of accelerating its bonds with many countries in the continent. Through cooperation on innovation and health, and by participating in meaningful scientific projects, Israel seeks to learn, assist, and join forces with some of the most impressive and important medical challenges in Africa that may contribute to shaping the medical world in the future. We are proud to be part of today's hard work that would create a better tomorrow. Nonetheless, we see the Rise of Hope initiative as just one example of the new heights our partnership in the African continent can accomplish. And we are certain that we can reach even greater peaks together. Thank you once again, and I look forward to a meaningful and fruitful event.
Thank you very much, Your Excellency. I'm now happy to give the floor to Her Excellency Ms. Luisa Fragoso, Ambassador of Portugal. Portugal has recently begun to expand their collaboration with the IAEA on the Race of Hope initiative. Excellency, the floor is yours.
Thank you very much, Director Gashu Gebier-Wolde, for this opportunity to address this illustrious audience. And through you, I address all the audience here with us today, dear ambassadors, dear members of the panel, dear participants. I would like to congratulate the organizations, IAEA, for organizing the International Forums of Ray of Hope at the African Union, where it was launched exactly in this building in Addis Ababa. Thanks the agency for the organization of the event once again and for the very positive results that the program has achieved over these past years. This event is particularly timely as it occurs in a moment when we perceive a renewed interest in nuclear energy, not necessarily in a positive way. Therefore, this is a much welcome opportunity to consider together how member states can safely use nuclear science and technology for peaceful purposes, a key one in health. We express appreciation for IAEA's leadership in scientific and technological cooperation in the nuclear field, underline that Portugal shares the vision of Director General Grossi to ensure that the benefits of nuclear technologies will be in the reach of all countries and people. Commend the determination and leadership in this path that will guide us all to the important goals that I referred to. As a member of the agency's technical cooperation program, of which Portugal is simultaneously a contributor and the beneficiary, we reiterate interest in the peaceful use of nuclear energy. Despite having chosen not to have nuclear as one of its energy sources, Portugal is nevertheless fully aware of the significant progresses made in nuclear science and technology and the prospects they have opened to its use to achieve global goals in a wide range of applications, going from health to agriculture or environment protection. Within the framework of the Memorandum of Understanding between Portugal and IAEA, 59 professionals from 17 countries have already been benefiting from education and training in Portugal. We will continue to do so, providing support for the education and training of professionals from developing countries, namely from Portuguese-speaking countries, to whom we are united by history and a shared language. I expressed our continued commitment to promoting nuclear science, particularly in the areas of radiation, oncology, and health applications. Cancer is among the top causes of death worldwide, as we have been hearing before. The Race of Hope program is particularly interesting as it can play a decisive and much-needed part in extending quality medical care to all parts of the world, contributing to diminish the current disparities among countries in access to cancer diagnosis and treatment instruments. We reiterate that Portugal is a proud contributor to the initiative Race of Hope. And in the same vein, Portugal has been very committed to global health and universal access to cancer healthcare, particularly in the African continent, and with the Portuguese-speaking countries, through a structured and supportive approach underpinned by the cooperation strategy to 2030. I thank you for the opportunity to address the audience and wish you fruitful deliberations. Thank you very much.
Thank you very much, Your Excellency, for the intervention. I now call upon Mr. Solomon Getachew, Director General of the Technology Authority of Ethiopia, to make a short intervention on the role of sound national regulatory infrastructure to support the safe and effective delivery of radiation medicine services. Mr. Solomon, please.
Thank you, Mr. Gashau, and I thank you also all the panelists and donors for providing us their vast experience. Coming to the question, as we have discussed so far, the application of radiation and nuclear technologies has a tremendous benefit in the sector of the health, industries, and agriculture, and so on. But among these, the dominant one is the health sector. So by having those benefits, unless and otherwise we properly utilize this radiation and nuclear technology, we might also create a problem like cancer, and also might reach also death by improper utilization of this technology. So we need to have a very proper utilization of this technology. To have a proper utilization of this technology, the states need to establish very effective regulatory infrastructure, especially by its nature of the application for the health sector. These applications need to be safely utilized for the sake of the occupations like workers, for the patients, and the public at large. So to do so, the establishment of the proper regulatory infrastructure, we need to have an independent and effective regulatory bodies. As Ms. Hiot mentioned, Ethiopia has established an independent and effective regulatory authority, which is the Ethiopian Technology Authority, who is mandated to regulate the radiation and nuclear technologies. So during the application of this technology in the health, specifically in the health sector, we have established a regulatory system by aligning with international standards. We are very much lucky to have an International Atomic Energy Agency who regularly publish international standards with a very close involvement of member states. So having such an international standards is very good documents as a reference documents during our preparation of and establishment of our national standards. So alignment of this international standard is very crucial for the safety of the patient and the workers, and at large to the public as well. During the functioning of these regulatory functions, we call it the authorization, inspection, and enforcement. These are regulatory functions. We need to have very skilled personnel within the regulatory systems to properly evaluate the licensing documents before issuing of the license. And after issuing of the license, we also conduct an inspection to each and every. It depends on the hazardous effect of the practices. Basically, we are using the graded approach. For those has a very high hazardous effect might need a very frequent inspection mechanisms. During our inspection activities, our inspectors are examining and checking whether the facilities has a very skilled personnel to operate those equipments, be it for diagnosis and for treatment purpose. And not only this one, whether it is properly functioning of the equipment, we also check whether the licensee has conducted a quality assurance program to properly functioning of the equipment. Unless and otherwise the equipment are properly functioning, the workers and the patients might be in hazards. By its nature, in the application of the health activities, we cannot set a limit for patient safety. Rather, diagnostic reference level, which is in international practices to refer for optimal doses to the patients. So we are now exercising to have such a national document reference level with the involvement of the Ministry of Health and different authorities and even the licenses. So having all these things, we can assure that these technologies can properly deliver its purposes. So by having with all these things, we are doing our best. We have passed a lot of challenges basically, especially with the alternative technologies, especially when cobalt-60s are changed with the LINAC. Basically, it is a state-of-the-art of technology, basically. We need to revise our regulatory system requirements, and we need to have a very skilled personnel to review the documents, to check the shielding calculations and the bunkers of the LINAC, and also making an inspection. So thanks to the IAEA, and of course we have a very good partners with USNRC, United States regulatory body, to capacitate our staff. So by now, I can say we do have a very good regulatory system for a proper utilization of this technology. I thank you very much.
Thank you very much, Mr. Solomon, and I deeply apologize to participants about our use of the time slot, but it was a very engaging discussion. I believe the lessons learned and the experiences shared will continue serving as source of inspiration for our work together through multiple partnership avenues and resource mobilization to support the Race of Hope initiative, develop sustainable capabilities, and expand equity for cancer care in all our countries. Thank you very much for the participation. Thank you.
Thank you very much. It was really very good experiences and lessons from the countries that we have heard, and we have also learned a lot from the donors side. That was very great one, and thank you for doing that. So, saying this, we'll pass to the next panel. The next panel is on Race of Hope, Latin America and Caribbean. So Mr. Luis Longoria will be moderating the session. The floor is to you, Mr. Luis.
Good morning, ladies and gentlemen, colleagues, partners. Your Excellencies, this session is entitled Race of Hope in Latin America and the Caribbean. My name is Luis Longoria. I'm the Director for Technical Cooperation for Latin America and the Caribbean. I'm very excited to be gathered today. Some of you participated in an event last year where the plans were laid out for the Race of Hope in Africa and then in Latin America. In Latin America and the Caribbean, I'm very pleased to convey the message that we made significant progress in advancing the needs that have been identified in the first wave of countries. The resources that we mobilize through our partners and concrete steps to increase the cancer care for patients requiring radiation medicine. I'm very proud of the hard work that I accomplished together with the member states that build physical infrastructure in record time and for the generous contribution from the donor countries. Without all of you and everybody in the program, this wouldn't have been possible. Today, I have the pleasure of being surrounded by distinguished panelists from some countries of Latin America and the Caribbean. I would like to introduce the members of the panel today. From Honduras, Mr. Daniel Brizuela from the Ministry of Health. They have made very good advances in the cancer care in the country. From Mexico, we have Mr. Jorge Ortiz Gonzalez from the Oncological Center of Veracruz in Mexico. We have Mr. Guillermo Batista from the Caja de Seguro Social from Panama. Mr. Cesar Federico Lorenzo from the University Hospital in Uruguay. Mr. Victor Palacios Cabrejos, from a member of Congress from Peru. And Mr. Fitzgerald Mitchell from the University West Indies in Jamaica. And Mr. Luis Rovere, Vice President of the National Commission of Energy, Atomic Energy in Argentina. And Mr. Ariel Fariñas Barrios from the Foundation Arturo López from Chile. Let me first ask the intervention from Honduras. Honduras is one of the few countries in the region that didn't have a public cancer center with advanced technology. Through the Rays of Hope initiative, they have initiated a program, very robust program, and together with very close partnership with Japan, they have been able to make great advances in this respect. So I would like to ask Mr. Brizuela to tell us about this journey that Honduras has taken together in a tripartite way, the IAEA, Japan, and Honduras. Please.
Good morning, everyone. First of all, it's a true honor to me to represent the Ministry of Health of Honduras at this important forum and to share our national experience in expanding access to cancer care. I thank the IAEA for this invitation and for their continued support to countries like mine, where every step toward improving cancer services makes a meaningful difference in the lives of our people. On behalf of the government of the Republic of Honduras, I wish to emphasize the vital importance of the IAEA's Technical Cooperation Program. Through advanced and safe technology, expert guidance, and specialized training, this program has been instrumental in supporting our national efforts to fight cancer. In Honduras, cancer is the second leading cause of death among adults after cardiovascular diseases, making this collaboration essential. Honduras, like many developing countries, faces significant challenges in public health. However, in recent years, we have embarked on a comprehensive transformation of our healthcare system, investing in infrastructure, equipment, and human capacity to strengthen both primary and secondary care services. This includes building new health centers, modernizing hospitals, and critically, expanding access to cancer diagnosis and treatment. The role of the IAEA has been central in this effort, In 2019, with IAEA support, Honduras inaugurated its first public brachytherapy service at Hospital San Felipe, located in our capital city, Tegucigalpa. This was a groundbreaking milestone for our country. 4 years later, in 2023, we proudly opened the first public nuclear medicine service, also at San Felipe Hospital, again with the technical guidance and commitment of the IAEA. This year, we are working to install our first public linear accelerator, LINAC, a major leap forward in radiation oncology for Honduras. Thanks to the IAEA assistance, we not only have the equipment, but also the training programs and safety frameworks needed to ensure its effective and responsible use. We expect that this LINAC to be fully operational before the end of this year, 2025. But we are not stopping there. With earlier support from the United States and now through a triangular cooperation agreement between Japan, Honduras, and the IAEA, a second LINAC is being funded. This will allow us to expand access to modern radiotherapy services in additional regions, ensuring more equitable coverage across our territory. A key component of this expansion is the new Comprehensive Oncology Center being developed in San Pedro Sula, our country's second largest city. This facility will include a bunker with 2 new linear accelerators, a brachytherapy services, and beyond radiation medicine, it will offer surgery rooms, inpatient beds, chemotherapy, transfusion medicine, and other essential cancer services. It is designed to be a fully integrated cancer center, reducing the need for long-distance travel and consolidating care in one location. Importantly, the support of the IAEA has been present from the earliest stages of this project, guiding the planning, architectural design, development, and implementation phases. This long-term collaboration has ensured that our national oncology services are aligned with international best practices from day one. Early detection is also a top priority. With the support of IAEA, 4 mammography units have been delivered, 2 to Hospital San Felipe in the capital city, Tegucigalpa, 1 to Hospital San Francisco located in the eastern department of Olancho, and 1 to Hospital General of Atlantida, situated in the northern coastal region of the country along the Caribbean Sea. These units are now contributing to the early diagnosis of breast and cervical cancers, particularly among women in vulnerable and underserved communities. We are also making progress in strengthening our regulatory and quality assurance systems. Just last month, in May 2025, the IAEA supported a national training course on radiation protection in radiotherapy for medical physicists and radiotherapy technologists, building local experience and ensuring our workforce is ready for this new era in oncology care. Ladies and gentlemen, this is not just a technical story, it is a human one. Every piece of equipment, every training, every consultation brings us closer to saving lives. We know there is still a long road ahead, but we also know we are not walking it alone. On behalf of Honduras, I express our deepest gratitude to the IAEA and its member states for believing in us, for working with us, and for empowering our health system to provide better care closer to home. Thank you very much.
Thank you very much, Mr. Brizuela, and thank you for sharing those crucial steps, and we're looking forward to continue working together for the projected projects that you have in the country. Now we turn our next speaker from Mexico, Dr. Jorge Ortiz. As you know, Mexico has outstanding experience in planning, constructing, commissioning, and putting to operation Indian accelerators facilities. But that is not the case in all the regions in the country. Could you please share with us the experience and how you ensure the local government commitment, the resources needed, as well as the benefits of the patients, and above all, the lessons learned along the way in the cooperation between the country, the team, and as a whole, the Rays of Hope initiative. Mr. Ortiz.
Thank you, Dr. Longoria, for your invitation to this awesome conference venue of Rays of Hope. Excellencies, distinguished guests, colleagues, I'm a surgical oncologist and a director of the State Cancer Center of Veracruz, Mexico. It's a pleasure to be here. First of all, I want to thank the IAEA for its support of Veracruz Cancer Center with a donation of 1 linear accelerator to tackle the cancer in a more effective way. In these minutes, I'm going to be reporting on the progress of the project of Cancer Center in Veracruz. In addition, I'm going to point out the support of IAEA to Chihuahua and Chiapas in Mexico as well. Mexico has 129 million inhabitants, and Veracruz has 8.5 million of people. We have 200,000 new cases of malignancies each year and 100,000 deaths by year. I would like you to draw your attention to the total number of radiation therapy machines in Mexico right now. There are 142 Linacs and 40 brachytherapy machines, but unfortunately, 60% of are centralized in major urban centers. Currently, Veracruz has in operation 1 Linac and 1 brachytherapy device in the public sector. And according to the IAEA, LMICs must have at least 2 Linacs per million of people. Due to this limited access gap, Mexico is moving toward a more equitable, regionally inclusive approach to cancer treatment. Thereby, let's move on to the Veracruz Cancer Center. Breast cancer is the first leading cause of malignant tumor, followed by cervical uterine cancer, endometrial cancer, and ovarian cancer. Prostate cancer is the first leading cause in men. The most incident tumor in Veracruz is cancer in women. Nevertheless, we not only treat adult patients at the Veracruz Cancer Center, but also childhood and adolescent patients. The most frequent patient treated with radiotherapy is the acute lymphoblastic leukemia in population lesser than 5 years old. Currently, in Veracruz Cancer Center, the total number of patients treated in 2024 with both 1 Linac and 1 brachytherapy device were 1,200 cases. 1 Linac attended 60 prevalent patients each day for Monday to Friday, and served 800 new cases by year, roughly. 400 new cases were treated in the brachytherapy machine each year. Now let's talk about the main features of the LINAC project at Veracruz Cancer Center. Overall, I want to know that Veracruz Cancer Center, the awesome technical cooperation between IAEA and the Veracruz government, and the astonishing intervention of both Health and Energy Ministry of Mexico. The project includes the equipment and infrastructure of radiation therapy facilities and is made up of as follows: 1 LINAC donated by IAEA, and the equipment is shipping process because we have pending the import permit of the documents. Moreover, we have 2 LINACs, 1 brachytherapy and 1 CT scan simulator, which were purchased by the Veracruz government, and they are being connected in these days. Talking about the infrastructure, the project includes 3 new bunkers, planning station, teaching room, and so forth, which were finished 6 months ago. But let's turn to this talk to Cancer Center in Chihuahua, in which IAEA has supported the first LINAC publicly available. And in the same context, in 2025, a second LINAC is being procured for installation. Additionally, I want to comment that 5 mammography units were delivered in 2024 by IAEA to enhance early detection and breast cancer screening. 3 units to Chihuahua and 2 more to facilities in Veracruz. Let's go on with another state of Mexico. IAEA and Health Ministry of Chiapas has a plan to install the 3rd LINAC soon. Now, let me talk to you about our experience to ensure the government commitment to the project at the State Cancer Center in Veracruz. Before 2023, we used to use both 1 LINAC and 1 60 cobalt teletherapy unit. However, the cobalt unit reached the end of its useful life, and we had to carry out the commissioning process. Consequently, the LINAC had over-demand of patients who need radiotherapy. Overall, we worked in planning, organization, leading and controlling a new project. And finally, a proposal was generated. But how the proposal was approved by the authorities. The most important step in this point is the advocacy for radiation therapy and political will, who walk hand in hand. We used some ideas to argue with the authorities. First, the need of provide complete cancer treatment in order to improve the overall survival to international standard. Second, 50% of the patients will require radiotherapy in any moment of their cancer evolution. Up to 30% will be cured with radiotherapy intervention, and radiotherapy is the most cost-effective cancer treatment. Mexican government commitment and the technical cooperation of IAEA have been carried out in an extraordinary way. I would like to conclude with these basics. It's clearly evident the need of the radiotherapy equipment in Mexico. The project LINAC in Veracruz, Mexico, will improve the coverage of radiotherapy treatment in all the states and at least 5 states around Veracruz. IAEA support for the Cancer Center with a donation of 1 linear accelerator is important for us. Nevertheless, it's only a complement of the original project. And finally, coordinated efforts between IAEA and state governments of Mexico will do more strong and equitable cancer care Mexican system. Thanks for hearing me.
Thank you very much, Mr. Ortiz, and thank you for sharing the experience of implementing this program of cancer in the state of Veracruz, Mexico. This is a clear example on how the IAEA is a complement to the efforts that every member state is doing to raise the awareness, to actually get the different authorities, actors together to a common approach. And together with the IAEA and the partners, we are being successful. Now, I would like to turn to Panama. Panama has also, for many years, a cancer treatment facilities in Panama City. However, as population grows and the needs are bigger, there needs to be a decentralized of certain services. Also, the country, like many countries in Latin America and around the world, have different type of health systems, federal, provincial, and even city government. So I would like to ask Dr. Batista to share the experience and how the different actors in Panama can come together and build on this national cancer program. Thank you.
Thank you. Thank you very much. Good morning. My name is Guillermo Batista. I am a medical physicist. Thank you for inviting us. Our country have been a good and excellent relation and support for the agency at least 20 years, 25 years ago. In Panama, we have only one installation with radiotherapy. Cancer care was centralized in a single center located in Panama City. Our population is around 4 million people. In case of radiotherapy, we have 3 linear accelerators that treat 100 patients per day over 12 to 14 scheduled hours. In case of radiotherapy, we treat 85% of all patients of the country. This result of our center being truly overcrowded, with a very limited management capacity that due to space constraint. 2 years ago, with the support of the agency, a new radiotherapy center was designed and developed to include radiotherapy with a high technology Linux. With this plan, we started to decentralize the service, and with the support of the agency that was involved in the planning, design, and management, we started with 3 new Linux accelerators and 1 hybrid MRI Linux. With this installation, our capacity was doubled and increased. In a new installation, we doubled started the decentralization. At present, with the support of the agency and the donation of a new Linux, we are planning to open a new radiotherapy center in a province 500 kilometers from the capital city. The new centers will have 2 accelerators, one provided for the rates of hope and another by the government of the country. With this installation, we started the decentralization of the service, improving the patient care and patient quality during the
treatment, because the treatment move near from the patient, and the Red of Hope initiative is a big support in this project. The decentralization is an urgent need in the country. It has been evident in the last 10 years. At this moment, with the support with the Red of Hope, we're planning to have 2 oncology care centers with new installation of radiotherapy in the most populous province of the country. We already have the experience that our previous center, and we started 3 months ago, and at this time we are treatment 120 patients per day, and we completed in 3 months 100 treatment. Red of Hope initiative have been essential support in the increase and improvement of patients treatment in Panama. Thank you very much.
Thank you very much, Dr. Batista. A clear example on how collaboration, cooperation between the different authorities in the country at all levels of the health systems and working together with one aim. And as you can see, it's an example of just a small but important contribution from the IAEA through the Rays of Hope initiative. It can detonate a project that grows in size and success. Now we would like to give the floor to Mr. Cesar Lorenzo. Mr. Lorenzo, can you tell us how in your country look at the cancer as a whole? Uruguay is one of the most advanced countries in Latin America in the treatment. However, there are still gaps, and those gaps have to be treated. Especially in like other countries, some of the hospitals are in the academic world at the university level. They're there. So how is the different, again, the different authorities, different entities in the country cooperate in one cancer forum? Please.
Thank you very much. Thank you, Mr. Longoria. Thank you, the IAEA and the Ministry of Health of Ethiopia for the invitation. My name is Federico Lorenzo, MD. I am a professor at the Hospital Clínicas, University of the República in Uruguay, the only center in Uruguay dedicated to training radiation oncology and RTTs. A summary briefs. Uruguay is a small country in South America, especially we compare to our neighbor, Argentina and Brazil. However, it has one of the highest cancer incidence rates, similar to USA and Europe. With a population about 3.5 million inhabitants, the country reports 16,000 new cancer cases and 8,000 cancer deaths per year. In fact, this year, cancer became the leading cause of death in country, surpassing cardiovascular disease. About technical capabilities, Uruguay has a relatively sufficient number of accelerators, but with limited technology. Uruguay has a long history of technical cooperation with the IAEA. One highlight is the development, the project for installation, a high-dose radiotherapy brachytherapy program using a cobalt source, being one of the first centers in the region with cobalt source. A key milestone, we having received an impact review mission in 2021, which emphasized in early diagnosis and improvements in public radiotherapy service. Regarding the Ray of Hope initiative, in December 2023, we had the honor of receiving the visit of DG Rafael Mariano Grossi, who announced the donation of a new LINAC for the clinical hospital with advanced capabilities, including SBRT, VMAT, and IMRT. This announcement was very important for working with the IAEA as partners. It gave our institution the opportunity to design and develop a new project that includes the reconstruction of radiotherapy, the oncology, and the hematology departments. At this stage, we have already received valuable support from the IAEA experts. This was also a turning point. Thanks to this initiative, the hospital leadership's priorities radiotherapy service. The project was designed with patient in mind. It includes improved patient flow, a redesigned waiting area with view of the park, of the garden, the construction of 2 new treatment bunkers, new outpatient consultation rooms, and a day hospital with 28 chemotherapy chairs. And how will it be financed? Uruguay is a country with a deep passion for soccer, and the grounds where our hospital is located are the next to the Centenary Stadium, famous for being the first stadium to host a World Cup. Government authorities have committed to funding the hospital renovation, aiming to complete a new clinical hospital by 2030, coinciding with the World Cup. But the radiotherapy department has been included as a key component in the first phase of reconstruction. In conclusion, Ray of Hope has become an excellent opportunity to improve the overall treatment of cancer patients in Uruguay. We are committed to become an anchor center for the region in near future. Thank you very much.
Thank you very much, Mr. Lorenzo. And as you can see, very imaginative ways of approaching cancer as a whole, even including members of other parties like football in Uruguay. Again, you have seen that the country puts a lot on these projects, and the IAEA is used as a leverage to have this impact in the country. The countries already have, in many cases, designed new facilities. And this will only not help just the country, but the other countries that are thinking of developing a new cancer center. We will share, and we are sharing amongst ourselves, the design of the bunkers, the design of the facilities, the treatment, etc., etc. Now, I would like to turn to Peru. Mr. Victor Palacios, from your position, can you tell us a little bit on how the efforts of a national program for cancer in the country is taking shape? This ambitious program has a lot of parts, and one of those is the IAEA contribution. Please, Mr. Palacios.
Thank you. It's an honor to be invited to share my country experience. 15 years ago in Peru, cancer care was largely centralized in Lima, with only limited services available in other cities such as Arequipa, Trujillo, or Huancayo. Today, oncology services are available in nearly every region of the country, with just 2 regions still lacking access. In the coming months, the entire population will benefit from fully decentralized cancer care. Despite progress, a major challenge remains closing the training gap for oncology specialists and subspecialists, especially in pediatric oncology. Expanding access to nuclear medicine and radiotherapy services within the public health system continue to be a top priority for Peru. The Impact Mission 2014 in Peru outlined 65 recommendations, 23 of which were deemed priorities, and over 80% of them have since been implemented. Chief among these achievements was the creation of the Executive Directorate for the Prevention and Control of Cancer within the Ministry of Health. This milestone empowered the ministry to take a leadership role in the cancer prevention and control by developing and executing case public policies aimed at strengthening the health system and decentralizing oncology services. As a result, the ministry has led the development of a national cancer plan, a national palliative care plan, and the implementation of the Global Initiative for Childhood Cancer. Additional milestones include the rollout of molecular HPV testing with self-collection for cervical cancer screening, improve diagnostic and treatment capacities in oncology-equipped hospitals, and policy advancement that ensure access to essential and innovative cancer medication. We extend our sincere gratitude for the donation of 2 mammography units to our Technical Cooperation Initiative. These units will be installed in rural areas of northern Peru, where many women currently face significant geographic barriers to accessing mammography services. This new installation will contribute to the global expansion of the telemammography network, which include more than 74 mammography machines within the public sector. This effort is aimed at strengthening the country's early breast cancer detection program. At the 2024 Ministerial Conference, Peru Ministry of Health presented a prioritized portfolio of 5 projects, highlighting the strategic importance of the donation of 2 LINACs and 2 PET-CT scanners. This initiative is expected to enable, for the first time, the decentralization of the nuclear medicine services using PET-CT technology within the public health sector. Most importantly, it will bring radiotherapy services for the first time to the region of the Peruvian Amazon with the highest incidence of cervical cancer. The support provided by the International Atomic Energy Agency has had a significant impact on cancer prevention and control efforts in Peru. This assistance has included expert technical support, training in the use of advanced radiotherapy and nuclear medicine technology, and the donation of essential equipment. Looking ahead, the potential for additional donation of nuclear medicine and radiotherapy equipment will further strengthen the decentralization of cancer services and help ensure timely, high-quality care for patients across the country. It is hoped that in coming months, a budget of $25 million will be secured to finance the acquisitions of such equipment to the Rise of Hope initiative in Peru. In an additional comment, a critical factor in achieving financial sustainability for public policies on cancer prevention and control is the establishment of a legal framework that enables the prioritization of financial resources. So, a market intangible funds. Different works in Peru have supported a sustained annual budget increase of $150 million over the past 3 years, aligned with the implementation of National Cancer Prevention and Control Plan. Thank you.
Thank you very much, Mr. Palacios, and for the detailed explanation and highlights on how the IAEA with partners can improve cancer care services. Now, let's turn to the Caribbean. This region is unique because of challenges shaped by geography, economy of scale, travel barriers, and a lot of the approaches have to be done in a regional way. And the IAEA, through the West Indies University in Kingston, Jamaica, have established a center for regional center for the English-speaking Caribbean. So I would like to ask Mr. Fitzgerald to tell us about how Jamaica is going about looking at the cancer at national level, but also how they leverage help to other countries in the region. Please.
Okay, thank you, Luis. And I also want to thank you for the way you have managed Latin America over these many years. You deserve a medal. I will speak to the government for you. You have done very well. We appreciate your help. And I want to just say quickly, just go back a little bit in history. Back in the 1990s, we have had a nuclear medicine program at the University Hospital of the West Indies. Somehow the program got derailed. We had folks who were, want for a better word, captured by major markets, and they migrated. The government and the University Hospital of the West Indies board decided that nuclear medicine was such an important program for not just the hospital, but for the country, that we needed to mount a delegation and go directly to the IAEA in Vienna. So we did that. We went. We met Luis, we met Director Yang. We spoke with them about the desire to reestablish the program back at the University Hospital, and again, a major program for Jamaica. They agreed. We made arrangements, and I want to thank the IAEA again, because not only did they agree with us, not only did they say, yes, we would give you a brand new spec CT gamma camera, but they also provided the technical support. They provided training, and all of yesterday we heard about the fact that training was a key part. They trained our physician, they trained our physicist, they trained the technician, they trained the pharmacist. And all these folks are now gainfully employed at the University Hospital, and are doing great work. They have made such an impact that the government of Jamaica has now decided that they are going to make sure that the cancer program becomes a national initiative, and therefore centers of excellences concerning cancer and other modalities have been established. One of the things that they decided to do was to ensure that we got the radiotherapy equipment in place, and that was to get the 2 LINACs at the major cities in Jamaica, one in the west and one in the east, and both those are doing quite well. There was also the need to get additional mammo units for screening, and the IAEA again came and did what they do best. They helped. They provided 2 mammo units, one at the major hospital in the west, the Cornwall Regional Hospital, and the other one in the Kingston at the Victoria Jubilee Hospital. Those 2 units are doing quite well as well. Plus, there are other units throughout the country privately, and there's also a unit at the University Hospital. Then we decided that, apart from that, Luis, the government decided that they not only needed to do the screenings, but to also make sure that the only PET-CT in the country that was a private PET-CT, we decided to approach, again, the IAEA to ensure that a PET-CT is also at the University Hospital. Those negotiations are ongoing, and we believe that we will, in the very near future, have our PET-CT. But what's most important is, as we design the building for the PET-CT, we were not left on our own. The team from IAEA sent representatives. They came down, they looked at our design, they told us what could work where, what couldn't go in this portion, whatever, and they helped us to make sure that those designs were well done and were able to accommodate the PET-CT. We believe, as the University of the West Indies and University Hospital, we are well positioned to take nuclear medicine right across the region. There's about 17 small islands within the region, Jamaica being one of the larger ones, and the University Hospital and the University of the West Indies reach all of these islands. So what we have decided to do was to ensure that all the contributing countries will be benefited by what we have learned and how we can assist them in getting them to understand the capabilities of using nuclear medicine technology in their region as well. They have sent their students to us. We are working with them. We're ensuring that they go through the paces just as how we did to ensure that their members in the various islands actually get the benefit of the care for this most dreaded disease. So we want to thank the IAEA for the tremendous work that you have done, you continue to do. We look forward to putting up our brand new building and putting in place that PET-CT along with the cyclotron for the new building that's to come in the very near future. Thank you again, Luis. Thanks, IAEA.
Thank you very much, Fitzgerald. You just heard how one country can help other countries in the region. 17 countries in the Caribbean that need treatment. They cannot all have their own center at this point in time. The reason why this has been a success in the partnership with the University of West Indies is because they have campuses in every island in the Caribbean. So that's why we were able to partner with the West Indies to have a master in medical physics, for example. So every student from all the countries can benefit from the same training and so on, and being able to use the facilities of the university. And we have plans to continue working with them to enhance this approach, as we see that the authorities in the country have seen the benefit of the partnership with the IAEA. Now, let me turn to another important pillar in the Race of Hope initiative, and is to do with the anchor centers. The first nominated anchor center, and so far the only one, is in Argentina. And Mr. Luis Rovere will tell us about a bit more on this idea. The National Atomic Energy Commission has 10 associated center institutes, and that together makes a big anchor center for the whole region. The cooperation with the Argentina at the anchor center is really very, very good. Argentina is going to be the first country that will install a proton therapy facility in the country. But Argentina is not just thinking on a national level. It will be also be available for other countries in the region. So we have here Luis, who can tell us a bit more on the plans on and how through the Race of Hope initiatives we can continue collaborating in this issue. Thank you.
Thank you, Luis. Well, in June last year, we signed the agreement to be participants to the Race of Hope initiative with the Atomic Energy Commission to be the main destinatory of the program, together with the institutes for university institutes, and then also the clinical institutes that belong either to the Atomic Energy Commission or are associated with, like, for example, the University of Buenos Aires, two oncological centers, plus one pediatric hospital that we mentioned in yesterday's intervention, the Institute Garraham. So the idea is that we can, as an Atomic Energy Commission, we come from the area of science, nuclear science and technology, not from the oncological part, of course, but we propose to impulse different activities regarding the radiotherapy concepts, nuclear medicine, dosimetry, radioisotope production, etc. So in 2015, the nuclear medicine program was launched at the national level, and that included the creation of several new centers and also revamping some of the old centers, providing linear accelerators, PETs, PET-MRs, SPECT-CTs, and new cyclotrons. Argentina had 3 public, from the Atomic Energy Commission, actually, cyclotrons, plus 2 private ones. We are in the process of commissioning 2 new ones this year, and probably 2 other ones that are in construction for next year, hopefully. So the idea is that the human resource is probably one of the biggest challenges in the country. We have seen that to be the case also in neighboring countries as well. We have had the master's program in medical physics for over 20 years now. We have had people from almost all countries in Latin America. So we decided to go forward and follow the IAEA recommendation for the technical training courses that they provide syllabus for these issues regarding radiotherapy, nuclear medicine, pharmacy, etc. So we have already elaborated one program that involves Instituto Balseiro in Bariloche and several training centers, like practical, let's say, training centers across the country. The idea is to harmonize the ways that these issues are taught. We have generated a program approved by the university and also was approved by the board of accrediting programs in universities across the country. So we now have kind of international affiliation through OECD package that our professionals will be recognized in different places. So the other issues that we have done are really being involved in the creation of this Frontera TP Center, which is really a huge investment. So far, we have invested more than $220 million for this project only. Hopefully, we will commission that in the first quarter next year, probably treating patients before the middle of next year. We are trying to partner with other countries. We have been with the Ministry of Health of Chile, for example. We have had contacts with people from Brazil as well, so that we will probably be providing some clinical services and also training services. We have participated in We are participating in uncountable number of programs with the agency, regional and national programs, and I really thank the IAEA compromise for helping Argentina setting up many of these issues, and we will probably be very much more active in the near future as well with this other center, which will be the first in the region. Other activities that we have developed are, for example, developed in this area is the use of artificial intelligence to enhance imaging for using less radioisotopes, for example, for PET images. One of our centers have developed an application that has been approved by our national FDA, let's say, agency, medical agency, and that has come as a result of research for many years, and that results in the use of half of the amount of FDG, for example, for clinical study. Or you can make the same resolution in half of the time, of course. So you get a factor of 2 in gain for these activities. Regarding the training in medical physics, we have created a clinical setting for training medical physicists, lasting 2 years after our master's in medical physics. Excuse me, and that brings the total studying time between different options for different students, from a short course, let's say, lasting 1 year, which is a diplomatura, to a master's, to a specialty with clinical approval from the nuclear regulatory body in Argentina. So we have different options for collaboration. We have started the program this February, and we already have 3 students that are coming through the IAEA to this program, and we are really happy about that collaboration with the agency. We have also one of the difficulties in Argentina was the treatment of oncologic pediatric patients in other places. And so we decided first to revamp the infrastructure that our Garrahan Hospital has, providing a new LINAC, a new EVO Electa, with dosimetry and planning tomography, etc. And that will probably be coming into operation next September. And that will be the center for training medical physicists and also radio-oncologists that we can spread throughout the country, and for those who are interested, we can train for other countries in the region through the IAEA as well. Some of the other issues that we have tried to improve is also the training in radiopharmacy, radiochemistry. We have had a long history of producing radioisotopes, moly, for technetium generators, FDG, etc., iodine. And now we are moving into the preclinical trials with lutetium and also actinium, and we are actively working in both areas so that we can soon start clinical trials as well. Atomic Energy Commission has turned 75 last month, so we have been members of the agency almost since the beginning. So we have had a long cooperation history, and we have then encountered a number of things with the agency, and we are really happy with all the collaboration that we have received and we have given to the agency and to other countries. One of the other things that we will be pursuing soon is complete and expand some of the quality assurance mechanisms that the agency provides for nuclear medicine, radiotherapy, and imaging, like Quantum, Quattro, and Quadrille. And we are also training some internal auditors so that we can extend the knowledge that we will be gaining from these activities with the agency to other parties. So we are really happy that we can contribute to the enhancement of quality assurance systems in our country and in the region. In summary, the Atomic Energy Commission is an integral hub for radiation applications on humans. As I mentioned, we came from the technological point of view, not the medical point of view, but of course we are closely interacting with these other sectors. We have several science and engineering research centers for the country. We are totaling now something like 4,000 people in these different centers, and we have the ambition to continue collaborating with the agency in whatever programs the agency considers necessary, and mainly and in particular the Rays of Hope initiative, which we understand will really change lives of many people in the region. So thank you, agency. Thank you, Luis, for your cooperation. We are really happy with your help. Thank you.
Thank you very much, Luis. For radiation oncologists who are at the front lines of precision cancer treatment, the IAEA supports since 2017 the Master of Advanced Radiotherapy in Chile. I would like to ask Dr. Fariña from Chile to tell us a bit more of this experience with the Master. Thank you.
Hello, everybody, and thanks for the invitation to share our master's program. I am the last one to speak this morning, and as a professor, I know that it's very, very hard to stay focused. But I'm going to tell you something very, very interesting, especially for my African colleagues. So please, I beg you that you please make one last effort now. First, I want to tell you where does the need to teach the master's degree come from? Well, there was a lot of inequality in the development of technology, of oncology and radiation treatments between the different Latin American and the Caribbean countries. So, IAEA developed a master's program of advanced radiation therapy to overcome this inequality through the update of the knowledge and the abilities of the radiation oncologists in our region and enable to improve the treatments of cancer and modernize their equipment. What's this master's program summary? Well, it's 1 year of training at FALC Cancer Center. It's located in Santiago, the capital of Chile. It's in person and full-time. The degree is from Universidad de los Andes and it's financed by IAEA, providing a scholarship to the students. And why at FALC Cancer Center in Chile? We have cutting-edge technology in radiation therapy. We have a Synergy, a Radixact, 2 Halcyon machines that enable to treat radiotherapy of patients with IMRT or perform an SBRT or extracranial radiosurgery. Also, we have a CyberKnife to perform a robotic radiosurgery or SBRT. And finally, we perform 3D brachytherapy with high-dose rate and an aeromobile CT system. What's our students about? They come from different countries in Latin America and the Caribbean, from Mexico to the north and Argentina and Chile to the south, passing through Cuba, Dominican Republic, Nicaragua, Costa Rica, Guatemala, Ecuador, Venezuela, Colombia, Uruguay, Paraguay, Peru, and Bolivia. The first generation were 15 students from 2017 to 2018. Over the next few years, we decided to reduce the number of the students to 7 or 8 for each generation to provide a more personalized teaching. Now we are teaching our 5th generation with 7 students, and 38 students have already completed the program. What's the program about? The students have practical activities and, in parallel, theoretical courses. In the practical activities, our students rotate every 2.5 months with different tutors. Each tutor has a different specialty. So our student can learn advanced radiation therapy to tumors from different systems. Students learn the correct contouring, planning, and evaluation of dosimetry plans for different clinical cases. The theoretical courses are physics, dosimetrics aspects, and quality assurance of both radiotherapy plans and machines. biostatistics, research methodology, and they must develop a research. And we have 3 workshops, 2 about radiosurgery, IMRT, SBRT, and partial breast irradiation. And finally, a medical ethic course. And now the interesting, please pay attention. Pay attention. What are the main achievements of our program? We have improved the level of oncology and modernized radiation therapy treatments in several Latin American and the Caribbean countries. We have made many changes in medical paradigms, like from just studying from only old books to studying through reading papers. I had students that have not read a paper in your life. It was in their life, and now they are capable to read papers and organizing meetings among different countries to update us, and we created a network to share medical topics. We have changed how our students treat different tumors because in some of their institutions didn't know the modern standard of care. For example, when a woman has breast cancer and 1 or 2 axillary sentinel lymph nodes positive, now she doesn't need an axillary dissection, and it could be replaced by nodal radiation. Many students only knew to old systemic therapies, like old chemos, and we teach them the new ways to treat tumors with new drugs, like targeted therapies and immunotherapy. Our students come with the knowledge of a standard fractionation, and this is important because we teach them that hypofractionation is safe and effective, so they will be able to shorten the waiting list and serve more patients, and this is very important. We have helped them to improve radiation therapy through the change of their old machines to more modern equipments that enables a higher quality, cost-effective, and with less side effects treatment. Nicaragua is maybe the best example of this. Our students were able to upgrade their only 2 cobalt machines for the entire country. And they replaced them for 2 Linux. And quickly they evolved to radiation therapy with 3D, and then IMRT BMAT treatments, and now they start to perform radiosurgery. So they now have happier patients. That's important. And soon they will install 2 halcyon machines. The same has happened in Bolivia, where they installed the first Radixact machine to treat the public system patients in La Paz. so they have happier patients too. And in Paraguay, one of our students helped to install and recently began radiosurgery treatments with the SAP-X machine. Finally, some of the research of our students have been published and others have won first places in different and important congresses in Latin America and the Caribbean. And finally, I would love to help to my African colleagues to maybe replicate this master's program to get better radiation therapy treatments in your continent. Thank you very much.
Thank you very much, Ariel. This is an example on how we together in the region collaborate and use what is most successful in one place and another and so on, and how the countries are ready to share with not only other countries in Latin America, but beyond these lessons learned. This master is an advanced oncological master's degree. It's been very successful because it's hands-on approach. It's not just academic virtual lectures. No, the students are there being almost personalized training and monitoring. So thank you very much, Dr. Fariña, for this. As we bring this session to a close, we were able to look at the progress and showcase what has been achieved in the member states and remind us that cancer care can be enhanced through collaboration, through partnerships, and a strong commitment from the shareholders involved. Whether through advanced radiotherapy, empowering health professionals, or ensuring equitable access to care, each of us has a role in shaping the future of quality cancer services. I would also like to mention that the IAEA, through the Race of Hope, it doesn't stop only in providing equipment. We accompany the countries in all aspects regarding the project. One important issue, has been mentioned before, is the assistance that we provide regarding radiation safety for the workers, the patients, the environment as a whole. This is always a must to have in this program, and we accompany you with that. We also accompany you with the design of those specialized infrastructure like bunkers, like where the distribution of the hospital has to be, the shielding that you have to have, et cetera, et cetera. And through the possibility that we have to provide certain type of equipment, we also help you to get the best technology that is the most suitable and advise you with expert missions, with advice, with collaboration with other countries, etc. And above all, we accompany you in the sustainability of these projects, because it's easier to start something, but it's more difficult to maintain it. So thank you very much, the audience, and thank you very much, Ethiopia, for having this successful Race of Hope initiative. Thank you very much.
Yeah, have a group picture. So stand up and have a group picture, the team. Thank you very much, all. So sorry, we have taken some time. We have an hour late according to our schedule, but still we will try to manage by reducing some time from our lunch. Now we will depart for lunch and we will resume our afternoon activity by 1:40. And the afternoon session closing will be by higher official from the government. So moderators of afternoon, I would like to tell you that to abide to your time and number of participation has to increase. Please be in the room in time. Thank you very much, and lunch is the same place we did yesterday.
Anybody else up? I'm just still here, so I left them with the slides.
There's no problem if you don't have the name tags. No. Good afternoon. Hope we had a very good lunch and coffee so that we can stay awake as it is the last day of the summit. So we will all attentively follow. So we'll start the afternoon session with the presentation of Rays of Hope in Europe and Central Asia. So our moderator is Ms. Miyumi Yamamoto, so the Program Management Officer, Division of Europe, IAEA. So the floor is yours, Madam.
Thank you very much. Good afternoon, Your Excellencies, distinguished speakers, ladies and gentlemen. Welcome to the first session of this afternoon titled Rays of Hope in Europe and Central Asia. As you have kindly already introduced, my name is Mayumi Yamamoto, and I'm a Program Management Officer for Europe and Central Asia in the IAEA Technical Cooperation Department, and it is my great pleasure to moderate this session. This session aims to highlight the cancer care gaps and diverse priority needs across several member states in Europe and Central Asia. Specifically, Bosnia and Herzegovina, Kazakhstan, and Tajikistan, which need strong donor support to strengthen cancer care systems. We also have a representative of Ege University in Izmir, Turkey, one of the first institutions designated by the IAEA as a Rays of Hope Anchor Center. We will hear their perspective on how the Anchor Center can contribute to long-term regional capacity building effort. Let us begin with our first speaker, Mr. Ivan Lazic, Director of State Regulatory Agency for Radiation and Nuclear Safety, to present the perspective of Bosnia and Herzegovina and how Rays of Hope can support the country's effort in cancer care. Please, Ivan.
Thank you, Mayumi. Ladies and gentlemen, good afternoon. It's my great pleasure to be here and try in my short presentation explain how Bosnia and Herzegovina want to enhance breast cancer detection. Next slide. My name is, like Mayumi said, Ivan Lasic, and I'm a Director of State Regulatory Agency for Radiation and Nuclear Safety. Bosnia and Herzegovina is a country located in Southeast Europe in Balkan region and has a population about 3.3 million people. Bosnia and Herzegovina is composed by two entities. One entity is a Federation of Bosnia and Herzegovina, and the second entity is Republic of Srpska, and we have also the small district Brčko. Like many countries in Bosnia and Herzegovina, women represent slightly more than half of this population. Breast cancer is the most common cancer among women in our country. And unfortunately, it's also one of the leading causes of cancer-related death in this group. In Federation of Bosnia and Herzegovina, the proportion of cancer deaths due to breast cancer rose from slightly above 15% in 2019 to about 18% in 2020. This reflects not only the rising incidence, but also delayed diagnosis. Many women are still diagnosed at the late stages, largely due to inconsistent screening coverage and lack of access to modern mammography, particularly in our smaller regions. Next slide, please. Bosnia and Herzegovina has established partnership with IAEA, and throughout previous and ongoing cooperation, we've trained professionals in quality control, in dosimetry, and medical physics. A major step forward is the newly submitted national project set for 26-27. It focuses on breast cancer diagnosis and treatment, from early detection to radiotherapy. The mammography units we are requesting will be foundational to this project, not just useful, but essential. Next slide, please. While our tertiary centers made a progress, many facilities still use computed radiography or even film-based system. These are outdated and do not meet modern quality or efficiency standards. The country is working to upgrade to digital radiography, but that process is incomplete. Donating 5 digital mammography units will significantly accelerate this transition, allowing us to replace non-functional or inadequate machines, particularly in regional hospitals. Next slide, please. Even among our tertiary hospitals, not all offer breast tomosynthesis or stereotactic biopsy, which are now standard in breast imaging. Digital breast tomosynthesis is especially important for women with dense breasts, while stereotactic biopsy enables accurate, minimal invasive diagnosis of suspicious findings. These technologies are largely limited to selected institutions in Bosnia and Herzegovina. A targeted donation would allow us to expand access where trained personnel exists, but equipment is missing. Next slide, please. We are committed to aligning with European standard for breast cancer screening and diagnostics. That includes modern mammography capabilities, advanced biopsy techniques, and digital integrations. Fortunately, we already have professionals to implement this. We have trained radiologists, trained radiographers, and medical physicists in place. Facilities are prepared to receive and operate the donated units immediately. Our QA system, supported by IAEA training, are ready to support them. Next slide. In conclusion, this donation would have a transformative impact on breast cancer care in our country. It will directly support the implementation of our upcoming national project by addressing the fundamental bottleneck, the lack of modern mammography systems, especially those equipped for tomosynthesis and stereotactic biopsy. The estimate value of this donation is 1.3 million euros. The investment will provide 5 state-of-the-art digital mammography units, each capable of supporting early detection, precise diagnosis, and alignment with European screening standards. Bosnia and Herzegovina is fully prepared to receive, to deploy, and maintain this equipment. Like I said in previous slide, we have trained radiologists, trained radiographers, and medical physicists. And we have identified the facilities where these units will be put to immediate use. We thank to IAEA for its long-standing support, and we believe this targeted donation represents both a high-impact opportunity and a natural continuation of our joint efforts to reduce the burden of breast cancer in our region. Thank you. Next slide.
Thank you, Ivan, for illustrating the National Breast Cancer Project and highlighting the concrete needs that can be addressed through the Rays of Hope. This includes 5 mammography units, which can substantially contribute to the improvement of the early breast cancer detection. The second speaker is Ms. Dilyara Kaidarova, Chairman of the Board, Kazakh Institute of Oncology and Radiology in Kazakhstan. Please.
Good afternoon, distinguished guests, dear colleagues. First of all, I would like to thank the IAEA for participating in this conference. And I want to share my presentations of a national overview of radiation therapy structure in the Republic of Kazakhstan, the current status, key challenges, and future development plans. Next slide. The population of Kazakhstan approximately 21 million, and the average of life expectancy 73 years. Every year, there is an increase in cancer cases in Kazakhstan, and the cancer incidence are 182 per 100,000 people. Cancer treatment are free for patients and covered by government. In Kazakhstan, we developed 3 national screening programs for breast, cervical, and colorectal cancer since 2008. And of course, we have good relations with many organizations, international. And in 2023, our government adopted a new national cancer control plan for 5 years. And one of the priorities is prevention, of course, early detection, treatment, workforce training, and implementation of palliative care. And one of the main key is to renew our old radiation therapy equipment. Next slide. Every year in Kazakhstan, we detected more than 42,000 new cases, and breast cancer ranks first place. And every year, more than 30,000 patients need for radiation therapy, but only 34% received therapy because of the lack of equipment, of course. And now we on the way to change all our old cobalt equipment to the new Linux. Next slide. The territory of Kazakhstan is large, and for the availability of cancer services, 20 oncology centers have been opened in each region, and also 2 oncology institutes operate in the country in the north and south part of our country. Here you can see on the map regional oncology centers with which equipment we have for radiotherapy. But 60% of equipment are very old, and more of them are cobalt 60. And now we started our program since last year to change all equipment to the new. Next slide. In summary, we have external beam radiotherapy units 38, cobalt 60-20. We have 1 gamma knife. Linear accelerated 25, tomotherapy 5, brachytherapy 17, and CT simulators, X-ray simulators, and the X-ray therapy. Next slide. And one of the main problem it is current staff. We have 75 medical physicists and 97 radiation oncologists. And now we develop the list of necessary training programs for physicists, radiation oncologists, and engineers, and submit it to IAEA. And next slide. And of course, our issues the lack of radiation oncologists, nurses, physicists, and engineers, educational gaps, few qualified trainers, especially for medical physicists, limited LINAC experience in regional centers, technical documentations mismatch with modern standards, need of an IAEA impact mission for systematic assessment and guidelines. Next slide. And we include in our new cancer control plan installations of 17 linear accelerators. 6 we installed in 2024, and now we're on the way to install 4. And in 2026, we want to install more than 5. And 19 CT simulators, 17 brachytherapy system, and of course to replace cobalt machines by Linux in our country. And we have our goals by 2027 that radiotherapy will coverage expected to reach 50–55% for our patients. And in the capital Astana, we have new National Cancer Institute, which one is equipped by radiation machine, PET MRI and proton therapy, and we are ready to organize an encore center in Kazakhstan, not only for our country, no, for Central Asia too. Thank you for your attention.
Thank you very much, Liliana, for outlining the National Cancer Care Plan of the Kazakhstan and also a set of measures to increase the availability of radiation therapy, in particular, the need for support in the capacity building of human resources. Now, I would like to give the floor to Mr. Olimjon Azizov, Head of Management, Public and International Relations Department of Chemical, Biological, Radiological, and Nuclear Safety and Security Agency in Tajikistan. Please, the floor is yours.
Thank you very much, Naomi, for introducing myself and giving me the floors. And good afternoon, dear ladies and gentlemen. On behalf of the Republic of Tajikistan, I would like to extend my gratitude for invitation to participate at this Race of Hope Forum and to the government of Ethiopia for organizing this vital gathering. This week we come together with a shared vision of building a health care system for the future. I'm honored to present Tajikistan efforts, challenges, and inspiration in promoting cancer care at this forum. Next slide, please. Tajikistan is a not nuclear country, and it's located in the thousand of Central Asia with 143,100 kilometers with a population of 10 million. And we border with Uzbekistan, Kyrgyzstan, China, and Afghanistan. Tajikistan is interested in exploring the nuclear technology in industry, research, food, and medicine. In our health system in cancer control, we have Republican Research Oncological Center in the capital and at the region. In the slide, we have a regional oncological center in the north, east, west, and west-south part. Besides this, we have several radiological departments across this region. Next slide, please. Tajikistan started cooperation with the IAEA in 2003 and collaboration with the TC department from 2004. Since then, 5 national projects in human health have been developed and submitted to the IAEA TC program with a total budget of 7 million euros. Currently, 3 national projects from there are ongoing, and we are focusing on improving diagnostic service in the capital and at the region. Next slide, please. At this slide, I would like to share with you a short video. Is it working or not? Can you hold this? Yes, thank you. At this slide, I would like to share with you a short video about collaboration and synergy between the TC department of the Sorry, it's too loud. Okay. Here is our cooperation and synergy between Tajikistan and the TC department of the IAEA. The first project on human health was submitted in 2005 with a budget of 1.2 million euros aimed at upgrading radiotherapy services at the Republican Oncological Center in Dushanbe, in the capital of Tajikistan, and it's the north part of Tajikistan at the region. Within the framework of this project, the 8 expert missions have been conducted, and the more than 12 international experts have been visited to Tajikistan during the 20 years. And these projects have delivered to the Tajikistan, especially for UNCOT centers, the medical equipment such as radiotherapy, brachytherapy, X-ray unit, ultrasound, mammography, and other medical tools for diagnosis and treatment. All these national projects have significantly improved the diagnosis services in Tajikistan. Besides this, within the framework of these projects, 7 scientific visits have been conducted in the modern oncological center in abroad, and more than 18 young medical staff have been educated in the foreign countries. Also, all these joint efforts contributed to saving life in Tajikistan and its region. Next slide, please. Nevertheless, over the past decade, cancer morbidity in Tajikistan has risen significantly from 141 cases in 2010 and 201 new cases in 2023 per 100,000 population. This increase underscores the growing incidence for malignant neoplasm and urgent need for enhanced prevention, diagnostics, and treatment strategy. There is some statistic which is indicated in this slide. Next slide, please. Cancer mortality highlighted gender-specific trends during the past couple of the years, as I mentioned, which were observed as follow. The among of the men's stomach cancer accounted for 16% of deaths, which is a high. The most of men have a stomach cancer, and colorectal cancer it's 11, and lung cancer at the 10%. And there is others cancer which is indicated in this slide. For women, there is the most popular is a breast cancer. The leading causes is 22%, followed by cervical cancer 50%, uterine body cancer at 8%, and stomach cancer at 7%. These statistics reflected the crucial need for target intervention to address prevalent cancer in Tajikistan. Next slide, please. It means that Tajikistan still have challenges in the healthcare system, such as the many cancer diagnoses occur at the late stage due to inadequate screening and diagnostic. We have the limited access to modern imaging technologies such as the PET and LINAC. And we have also limited qualified specialists in new and modern technology like the PET and LINAC. And also, for your imagination, dear colleagues, we have only 2 cobalt machines for 10 million population currently, which exists in Tajikistan. However, per the international recommendation, it's necessary to have at least 1 radiotherapy machine per 100,000 people. Also, the many countries already switched to the modern technologies, such kind of our colleague from the Kazakhstan mentioned about the PET and LINAC. However, in the country, we still use the old machine with the cobalt-60 equipment. Unfortunately, the government of Tajikistan has a limited budget in this area. In this regard, we rely on the international support. Next slide, please. Despite of this, there is good news. We already recently developed a new national strategical program for cancer control for 2025 and 2029. And we also submitted the new proposal project for IATC, the Department for New Cycle 2026 and 2027. The project aim is to improve the quality of life of cancer patients through the improved diagnosis and treatment techniques via IAEA Race of Hope initiative. The key objective of this project is to include transmission to the new technology for diagnosis and treatment, such as PET and LINAC, improve diagnostic service in the remote area at the region of the Tajikistan, and train medical staff with a new technology, and establish a sustainable medical physics education program in the country. In whole our country, we only have 4 medical physicists. and we need to have some kind of the national program in order to develop these specialists in this area. This ambitious plan seeks to address gaps in cancer control system, ensure access to quality diagnosis and treatment in all regions, and can be contribute for Central Asia countries as well. Here we showed there is one of the donor meeting which is recently have been conducted in Dushanbe. During those meetings, there is participated from the IAEA, WHO, and UN organization. We are explaining all the situation, current challenges we are facing in Tajikistan with all that machines, and there is some photos and objectives of this donor meeting. Next slide, please. Yes, next, please. Oh, thank you. It's I'm always admire with the Nelson Mandela quote. They say that it always seems impossible until it's done. That Tajikistan is ready to work with all international potential donors in order to transmission from the old technology to the new. And we hope the Race of Hope initiative will enhance healthcare system in the world and contribute cancer control in Tajikistan. In conclusion, on behalf of people of Tajikistan, I would like to express my deepest gratitude to the IAEA for their supporting and all other international partners for their role in their important, crucial role in this area. Your contribution play a vital role in saving life around the world. Thank you so much for your attention.
Thank you, Olimjan, for expressing the strong commitment of the Tajikistan to launch an ambitious cancer control program in line with the national strategy for cancer control for next 5 years, and outlining Tajikistan's priority needs to scale up the cancer services. So the last speaker from our region is the Anchor Center representative from Turkey, Ms. Deniz Yalman, from Ege University, who will speak from the Anchor Center perspective. Please, Deniz.
Thank you, Mayumi. Good afternoon, distinguished guests. It's a great pleasure to be here and speak about the critical role of anchor centers within the IAEA's Race of Hope initiative. Being selected as an anchor center is both an honor and a responsibility. I will be sharing now how we at Ege University Faculty of Medicine envision and embrace this role. Slide, please. Our mission is to support IAEA in strengthening radiation medicine capacity in our region by training qualified healthcare professionals in radiation medicine, fostering scientific research and international collaboration, and leading the delivery of sustainable, high-quality oncology services in alignment with the goals of the Race of Hope initiative. Next slide, please. Our vision is to become a recognized regional hub for education and training, innovation and research, and provide expert support to IAEA in radiation medicine. Through coordinated research and innovation, we can address regional challenges together. By building sustainable infrastructure and workforce, we aspire to contribute to the development of a more equitable, accessible, and sustainable cancer care ecosystem. Next slide. Regional capacity building means increasing the number of trained healthcare professionals, strengthening infrastructure and technical capacity, promoting scientific research and innovation, expanding access to cancer services across the region, and supporting sustainable health systems. Next slide. Long-term capacity building is not just about infrastructure. It's about people, partnerships, and purpose. Building capacity means saving lives. Collaboration is a key factor. As an anchor center, we are committed to sharing our experience, expanded access, and ultimately saving lives through improved cancer care. Next slide, please. A key pillar of our role in regional capacity building is education and professional development by organizing IAEA-accredited fellowship and residency programs, hosting regional training courses and workshops,
strengthening local teaching capacity through train-the-trainer models, developing online learning platforms to ensure sustainable access to education. By continuous training programs, we aim to build a robust regional workforce. Next slide. Research is vital for tailoring cancer care to regional needs. We have to actively participate in IAEA coordinated research projects, establish multidisciplinary research teams, develop collaborate projects through regional research networks, and so on. We aim to lead and support projects that generate meaningful data, foster innovation, and empower early career scientists. Next slide. As an anchor center, our responsibility goes beyond borders. We are committed to sharing our expertise and mentoring neighboring institutions, enhancing care quality across the region by sending experts to other countries or centers, share clinical protocols and quality assurance guidelines, providing guidance for the setup and organization of new centers, facilitating institutional partnerships for knowledge exchange. Next slide. Sustainability is central to our mission. By advising on infrastructure, forming strong institutional networks, contributing to policy dialogue, collaborating with universities, ministries, and international partners, and advocating for policy development and sustainable funding, we ensure that improvements last. Next slide. Partnerships and international networks are essential for enhancing knowledge and resource sharing. Next slide. Why is long-term perspective essential? Sustainable transformation requires more than equipment donation. It involves knowledge transfer, local capacity development, and policy formation. Anchor centers represent the sustainable foundation of this transformation. The ultimate goal is to establish a self-reliant, high-quality, and equitable oncology service infrastructure across the region. Next slide. Our journey has started with the signing ceremony in September 2023. We were selected as one of the first anchor centers in Europe and Central Asia. A new chapter of the IAEA-EGE collaboration has started. We attended the 4th February World Cancer Day. We hosted the Anchor Center's inauguration ceremony. Next slide. We organized the first Anchor Center regional workshop on the status of pediatric radiotherapy services in Europe with more than 100 participants all over Europe. Next slide. One of our colleagues went to Numeri for IAEA review mission to Steve Biko Academic Hospital. Next slide. Our physicist attended Train the Trainers workshop on how to teach treatment planning. We have distinguished guests for the review mission to Ege University. Next slide. We continue training IAEA fellows as we always did. Next slide. We took part in a collaborative research course with IAEA and MD Anderson Cancer Center. Next slide. We attended a training program for gynecologic radiotherapy in anchor centers, and we have initiated efforts to establish a brachytherapy simulation laboratory in our department. Next slide. We attended ICARO 4 and gave lectures there. Next slide. And our physicist attended second biennial meeting of dosimetry audit networks. This is our journey so far, but we have a long road ahead filled with responsibilities, but we believe we will succeed. Thank you. I would like to thank you for IAEA for giving this opportunity to us.
Thank you very much, Denise. Thank you for presenting the vision as the Rays of Hope Anchor Center and its concrete role in regional capacity building. The Anchor Center in Turkey has already been actively engaged in hosting training events for our member states, as we heard from Dennis now. We are very grateful for your support to our member states.
Thank you, Mayumi.
And we look forward to further collaboration, strengthening our collaboration together with other newly appointed Anchor Center in our region. Now, drawing on the presentations we heard today, from both member states seeking support through Rays of Hope, as well as the anchor centers supporting the Rays of Hope. We hope this session serves as a catalyst for deeper strategic cooperation and partnership. We also hope it inspires further donor engagement to support cancer care systems in Europe and Central Asia, where the need is both urgent and significant. In our region, we currently have at least 7 additional countries that have requested support through Rays of Hope, besides 3 countries we heard today. I would like to take these opportunities to emphasize the immense needs in the region, and it is hoped that Rays of Hope will continue to expand its reach to Europe and Central Asia as well. Now, I would like to extend my sincere thanks to our distinguished speakers for their messages, and also thank all the audiences for your attention to our session. And I would also like to thank His Excellency, Ambassador of Kazakhstan, to have kindly joined the session with us today. Thank you very much. Thank you for your attention. Do we take a meeting? Maybe we stand up? Okay.
Thank you. Thank you very much for the timely finishing it, and it was really very informative discussion. So hopefully we are learning a lot on how Rays of Hope is improving the services in different countries and continents. Now we'll hear the next panel, which is Rays of Hope in Asia and Pacific. Our moderator is Kimberly Frolov-Rosler, Program Management Officer, Division of Asia and Pacific, IAEA. Please, the floor is yours, Kimberly.
Good afternoon, everyone. Excellencies, distinguished panelists, colleagues, and guests, good afternoon. Welcome to our session, Bridging the Cancer Care Gap in Asia and the Pacific. As already mentioned, my name is Kimberly Frolov-Rosler, and I'm a Program Management Officer in the Department of Technical Cooperation for the Division of Asia and the Pacific. And it is my great honor to be able to moderate this panel session today. Now, to start on a personal note, I really enjoy working in the region, in Asia and the Pacific, because it's an incredibly diverse and dynamic region. We have a broad range of countries, ranging from high, middle, low-income countries, and that, for me, presents a great opportunity to build partnerships, to build resilient health systems. And this is what we're going to be discussing here today on this panel, how we can leverage different types of partnerships to make all of our healthcare systems more resilient and to be able to provide the cancer care to everyone who deserves it. Our focus today is on how multi-level strategic cooperation, particularly North-South, South-South, and triangular, can address persistent cancer care gaps. And you will hear today practical experiences from donors, recipient countries, as well as anchor centers in the region who are actively advancing cancer control. Now, before we begin our panel discussion, it is my pleasure to share a special message from His Excellency Changra, Minister of Health of the Kingdom of Cambodia. Cambodia is a priority country under the Rays of Hope initiative in Asia and the Pacific, and has made remarkable progress in expanding access to cancer care. And we're honored to include these reflections in today's program. Thank you.
Honorable President, distinguished participants, colleagues and friends, ladies and gentlemen. It is a great honor to join you today at the Ray of Hope Forum, a vital gathering of partners, policymakers, and advocates united in the global fight against cancer. On behalf of the Royal Government of Cambodia and the Ministry of Health, I extend my deepest appreciation to the IAEA and partners for their continued support in strengthening cancer care worldwide. Cancer is one of the leading public health challenges of our time. Nearly 10 million lives are lost to cancer each year, disproportionately affecting low and middle income countries. In Cambodia, we record approximately 20,000 new cancer cases and 14,000 deaths annually. One life lost for every 40 minutes. In partnership with the IAEA, Cambodia has made notable progress. The first and second impact mission in 2013 and 2023. The establishment of our first cancer center with radiotherapy and nuclear medicine in 2018. Capacity building through fellowship, expert mission, and equipment support. Endorsement of our first National Cancer Control Plan 2025-2030. This plan defines 6 key priorities aligned with global effort. First, preventing cancer by tackling risk factors like alcohol, tobacco, and inactivity. Second, scaling up screening, especially for cervical and breast cancer. Third, improving access to diagnosis and treatment, including radiotherapy and nuclear medicine. Fourth, integrating palliative care and long-term follow-up. Fifth, strengthening data system and research. And sixth, ensuring governance and sustainable financing. However, challenges remain. For a population of over 17 million, Cambodia has only 4 radiotherapy machines. Gaps in infrastructure and workforce persist. Yet, we believe that with targeted investment and solidarity, we can change this situation. The Ray of Hope initiative reminds us that we are not alone. Together, we can drive innovation, expand access, and bring real hope to cancer patients. Let this forum inspire practical cooperation and share solutions. I look forward to learning from this fruitful outcome. Thank you to the IAEA and organizer for hosting this essential event. And I wish you all a successful and meaningful forum. I thank you.
Thank you to His Excellency Changra, Minister of Health of the Kingdom of Cambodia, for these remarks. Now, let me begin by introducing our esteemed panelists, whose perspectives reflect the diverse stakeholders involved in the Rays of Hope initiative in the region. First of all, His Excellency Mr. Peter Hunter, Ambassador of Australia to Ethiopia and regional organizations. Dr. Mandul Engjarel, a nuclear medicine physician of the Second State Central Hospital of Mongolia. Dr. Sadaf Tufailbut from our anchor center, Nori in Pakistan. Dr. Kanchan Adhikari, professor and medical physicist at the Bir Hospital in Nepal. And Dr. Krisanath Chumsamadki, associate professor and nuclear medicine physicist at Ramatibodi Hospital in Thailand. Ambassador Hunter, I'd like to begin with you. Australia is a key donor supporting cancer care across Asia and the Pacific under the Rays of Hope initiative. As a donor country, Australia has supported both long-term development goals and agile responses to emerging health needs in the region. Now, from the perspective of a Rays of Hope donor, could you please talk about Australia's contribution to the global effort to reduce the burden of cancer through peaceful uses of nuclear science and technology? Thank you.
Thank you, moderator, for the gracious invitation and introduction. Esteemed fellow panelists, guests and colleagues, please all protocols observed. I'd like to commend the IAEA and the Director General Grossi for bringing us all together here in Addis at the Rays of Hope Forum to facilitate these important discussions. While this session will focus on Rays of Hope initiatives in the Asia Pacific, I wanted to also acknowledge that the discussions being held today are equally critical for Africa, where our meeting is based. We hope this forum will continue to build regional cooperation, including exchanging best practices and cutting-edge research between Africa and our Asia Pacific region. Eliminating cancer can only come with genuine global effort. Australia is grateful to work with partners around the world to reduce the burden of cancer and, where we can, eliminate it. As a founding member of the IAEA, Australia remains a steadfast supporter of its central role in upholding the Nuclear Non-Proliferation Treaty and as the primary forum for achieving the Sustainable Development Goals through the peaceful uses of nuclear science and technology. We are all aware that nuclear science, technology and its applications are capable of producing vast benefits for member states and play an indispensable role in addressing some of the most significant challenges of our time. Cancer is certainly one of the most pressing global challenges today, responsible for nearly 10 million deaths annually, and this number is expected to significantly increase over the next 2 decades. This projected increase stands in stark contrast to our shared commitment under the Sustainable Development Goal 3, which calls for a 1/3 reduction in premature deaths from non-communicable diseases, including cancer, by 2030. We have heard already about the devastating impact of cancer in Africa. Unfortunately, this impact is also being felt in Australia's own region, the Asia Pacific. The cancer burden within the Asia Pacific region is of particular concern. The reasons for this are varied and complex, but a key contributing factor includes inadequate access to affordable and quality treatment. I should note that this barrier is not unique to our region. As has become apparent, cancer care is often under-resourced, and in some cases even non-existent, in several low and middle-income countries. In this forum, we have heard about how the IAEA's Rays of Hope initiative is significantly mobilising efforts to enhance access to affordable, equitable, and sustainable radiation medicine services and building the cancer care workforce. Australia is proud to be a key partner supporting Rays of Hope and has provided 2.7 million Australian dollars since its establishment in 2022 to support efforts to increase access to cancer care within the Asia Pacific region. For example, Australia's contribution to Rays of Hope has provided radiotherapy and nuclear medicine services to increase people's access to high-quality health services and improve cancer management, control and treatment in Cambodia. Inadequate and inequitable access to cancer care is something we must address if we are to overcome the global cancer crisis. This is where Rays of Hope is continuing to make all the difference.
Thank you very much, Ambassador, for those remarks. Now, you've already spoken about Australia's role as a leader in supporting efforts to increase access to cancer care within the region, specifically through Rays of Hope. How does Australia's support for other IAEA programs complement the work being done through the Rays of Hope initiative?
Thank you again, Moderator, for the generous question. Through the Regional Cooperative Agreement for Research, Development and Training related to nuclear science and technology for Asia and the Pacific, that mouthful is more easily shortened to the RCA, Australia is working with over 18 partner countries in the Asia Pacific, including Cambodia, Mongolia and Thailand, to enhance health and care outcomes for cancer patients, including through the enhanced status, knowledge and skills of medical physicists in diagnostic and interventional radiology. Further, Australia has fully funded through a contribution of 750,000 Australian dollars a project in support of a cancer care project under the RCA I just mentioned. Building on 50 years of RCA projects aimed at improving patient outcomes in the region, this project will improve access to and use of quality oncology information systems to inform better cancer care in our region. The RCA is one of the regional implementing partners for Rays of Hope. The African equivalent, the African Regional Cooperative Agreement for Research, Development and Training related to nuclear science and technology, shortened to AFRA, similarly implements the Rays of Hope initiative in the African region. To complement and maximise the impact of these initiatives, Australia is also proud to be supporting the IAEA's Regulatory Infrastructure Development Project, RIDP. I promise I will come up with fewer acronyms soon, which aims to build and strengthen the legal and regulatory infrastructure within countries in Asia and the Pacific to enable their safe and secure use of radiotherapy and other cancer care capabilities. Australia's partnership with the IAEA seeks to take important steps toward achieving outcomes for the Pacific. The Pacific region has unique needs and is facing some of the most pressing challenges in the world today. A tailored, adapted approach is required, and the IAEA has recognised this in creating the sub-regional approach to the Pacific Islands, SAPI. SAPI, Rays of Hope, the Regulatory Infrastructure Development Project, RADP, the Regional Cooperative Agreement, as well as the IAEA more broadly, are all stepping stones on the pathway to building national and regional scientific capacity and monitoring capabilities, which Pacific Island Forum leaders committed to in 2023. Notable outcomes from our funding to date include the delivery of ultrasound systems and a mammography medical monitor to the Ministry of Health in Tonga under the IAEA's SAPI program. The development of sustainable, high-quality and safe medical diagnostic imaging and radiotherapy services with Fiji, the Marshall Islands, Papua New Guinea, Tonga, Vanuatu, Palau and Samoa. Finally, Australian institutions, cancer clinics and universities have a long and proud history of supporting and delivering practical IAEA training courses, workshops and events aimed at building cancer care capabilities in our region and further afield. We remain committed to these efforts and look forward to continuing to work with the IAEA and its member states to reduce and eliminate the cancer burden altogether. However, no single country and no one organisation can address the cancer care gap alone. And this forum has highlighted just how important international cooperation and partnerships are in addressing this debilitating disease. The IAEA is a global body which has expertise and supports us all. Its integrity and independence as a scientific body and the International Authority on Nuclear Safety are critical. It's up to us to guide the IAEA in how best to support us all, and this is why we are here today. I'd encourage you all to continue to share your priorities, and I look forward to hearing about your future successes and achievements. We hope that many of you might be able to join us in Melbourne, Australia, for the World Cancer Leaders Summit in November this year. This summit aims to drive ambitious actions and policies to reduce the global cancer burden and will continue many of the important discussions held at this forum. With that, allow me to thank you all for attending the forum today and for your interest in the positive impact Rays of Hope is having in the Asia Pacific, Africa, and the world. Thank you very much.
Thank you very much, Ambassador Hunter, for highlighting Australia's leadership and commitment to cancer care in the region. And I promise we'll work on creating less acronyms in the future. Really, Australia's contributions through Rays of Hope and complementary IA programs clearly demonstrate how donor partnerships can drive sustainable impact. And we very much appreciate all of Australia's support, and I'm very grateful to you. Now, let us turn to the institutions and governments working on the front lines to translate this support into tangible health system improvements. Dr. Injargal, Mongolia is an early and active participant in the Rays of Hope initiative, with major investments supported under the national TC program. Mongolia successfully launched cyclotron-based PET-CT services in 2021 and is expanding access through additional equipment like SPECT-CT and brachytherapy alongside quality control upgrades. My question to you is this: what were the key enablers of this achievement, and how has it impacted access to cancer diagnosis and care in Mongolia? Thank you.
Thank you. Good afternoon, the distinguished delegates and partners and colleagues. It's a great honor to be with you today to share Mongolians' experience in the expanding access to cancer care through the nuclear medicine. I would like to extend my sincere appreciation to the organizers such as the IAEA and the KRAMS Hospital for their continued support and collaboration. Over the past decade, Mongolia has made significant progress in strengthening the cancer care services, but important challenges still remain. Today, I would like to briefly highlight some key enablers of our journey and what we see the most urgent priorities to ensure sustainability. In 2015, the government of Mongolia launched the MIRE initiative to expand cancer care services by establishing the National Diagnostic Treatment Center with the support of the government of Korea. At that time, Mongolia had only one specialized cancer hospital, the National Cancer Center, which is primarily provided radiation oncology, chemotherapy, and surgical treatment. However, the outpatient follow-up, the palliative cares were limited secondary level, leading to fragmented care, limited access to specialized services. To address this challenge, the government prioritized increasing diagnostic and treatment capacity. At the NDTC became one of the key partners of this expansion. The nuclear medicine component was implemented under the KRAMS model, with infrastructure and human resource training supported by the KRAMS. As a result of this effort, Mongolia successfully launched the cyclotron-based PET-CT series in 2021 as the historical first in our country. Before this, the patients who had to travel to abroad for the PET-CT scans. Now the patient can receive the timely and accurate diagnosis, the better treatment planning locally, significantly reducing the financial and emotional burden on the families and improving access to cancer care in the nationwide.
Thank you very much for highlighting this and presenting this example of triangular cooperation between Mongolia, the IAEA, and KIRAMS in Korea. I think this is a really valuable example for other countries as well, how we can leverage strategic partnerships for enhanced capacity building support in the region. And obviously, this is also a very successful example of how this was done and how you managed to upgrade your nuclear medicine facilities as a result of this. Now, as a follow-up question, how do collaborations with international partners and strategic national planning support long-term sustainability and broader availability of nuclear medicine services, in your opinion?
In 2022, Mongolia has become one of the early participants in the IAEA Race of Hope initiative. This program aims to strengthen national capacity in both nuclear medicine and radiation oncology. One of the primary goals has been expanding the radiopharmaceutical production based on both cyclotron and generator-based systems, following increased type of the PET and SPECT applications. They improve the radiation safety infrastructure and increase the number of the SPECT machines nationwide. The crucial component is the program, the Human Resource Development. With the support from international partners, Mongolia has provided the fellowships and the short-term trainings, the opportunities for the engineers, the radiochemists, the radiopharmacists, the nuclear medicine physicians, and technologists. These investments in the people ensure the safe and effective, the sustainable use of advance of technologies. To date, we had already received the installed HPLC machine and one SPECT CT scanner and radiation safety equipment with the additional items such as the synthesizer, dispensing hot cell, and the second SPECT unit expected soon. The aligned international cooperation strategic national planning, Mongolia has laid a strong foundation for delivering sustainable, high quality, and equitable nuclear medicine services that will benefit the cancer patients to become.
Thank you, Dr. Njagal, for sharing Mongolia's progress and clear vision for expanding access to cancer care in the country. I think Mongolia's experience offers a powerful model for scaling nuclear medicine services in a sustainable and inclusive way. Now let's move to Nepal for a complementary perspective from a recipient country. Dr. Adhikari, Nepal has made notable progress in mobilizing funding for critical equipment and training. This achievement reflects not only national commitment, but also the strong collaboration between national and international partners. Could you please share how this was achieved and what lessons might be useful for other countries looking to secure similar investments?
Thank you, Kim. Thank you, Kim, and thank you, IAEA, for inviting me in this panel. It's my great honor to be the part of this. So actually, it's not easy. So what we have done, we have created the good team of the different stakeholders, and what we have done, we tried our best to convince the policymaker at each level. When we met them and when we talked them, we'll try to convince them. And what we did is we showed them the data, actual cancer burden data, as well as what we have showed that there was still, we do not have any single SPECT city in the whole country, in the public sector, but there are some at the private sector. So what we tried to convince them that if we buy the SPECT for the government public hospital, then the price, we can control the price, because the actually, and it's a very affordable to the, and actually we do have a government health insurance policy, so they get up to 100,000 Nepalese rupees, around $1,000, so around that, to that. So this, and IAEA support was tremendous during this period, and they helped us in communication. Also, IAEA Technical Cooperation team helped us in to put out, and they came and they tried. We go together to the different ministries, even minister. We met the minister in time to time. So it has helped us to and also the one of the main other point I would like to highlight that we have made, the government of Nepal has made the cancer as one of the national priority. So it also helped us to broaden these things. So in the as you have I have already there are challenges. So the main challenge is what we have faced is that we have convinced everything, we have done everything, but we have to wait because we have not made safety requirements set by the IAEA safety standards, as well as we do not have the updated regime profile. So I am very happy I am seeing some of the faces from the IAEA today, and we have discussed. So they help us in updating our regime profile, and it took 4 years to complete this. It's really pity that it will take, and we have to complete our room for the Aspect City. At last we did it, so it's coming, and as I belong to the low and middle income countries, the experience what I share with others that one should have the best, they have to align the national priority with the evidence-based data. If you work with the evidence-based data, then it would be help. And another thing that you have to engage with the policy makers. So you must have a good team, those who could communicate, who could convince the high-level policymaker, because they do have other priorities. Because the country where I belong to, they have a communicable disease is also one of the priorities in some of the things. So and other priority, and engaging with structured international organizations like IAEA. We have engaged with them in an SA, Office of Radiological Security, US government, so US DOE and IAEA. And other regional organizations like other regional organization. So and I would also like to say that what we have faced that one should have the robust regulatory infrastructure. So what you should have updated regime profiles. So before you get, if you ask any equipment for the donor institution or something like, you have infrastructure, and you must have the safety standards in accordance to the IAEA thing. Yeah.
Thank you very much, Dr. Adhikari. I would like to commend you on raising that point, because obviously also from an IAEA's perspective, this is a critical point. We of course want to support and do support as much as possible developments in cancer care, but we want to ensure that it's done in a safe and secure manner. And the way to do that is to strengthen the regulatory safety infrastructure in countries. So this is really, really important, particularly when it comes to equipment, to ensure that the regulatory safety infrastructure is on par to ensure the safe and secure use of radiation technologies. Now, just as a follow-up question, I know Nepal was involved in developing bankable documents as one of the financing tools. How has this supported your national cancer control planning, and what opportunities do you see for leveraging these documents to attract further external support from, for example, international financial institutions?
Thank you, Kim. This is a wonderful question. So actually, last month we were there in developing this bankable document. So the best part of what I have found is that I have written some points. The best part of what I have noticed is we have united disconnected different organizations to one. So when we were in the Vienna last month in May to develop the bankable documents, we have different institutions. So we have a regulatory body personnel, we have a Ministry of Finance who gives the money, and we have the Ministry of Health, and we have the urban development and building constructions people. So what is the best part of that is that everyone was scattered. Now that bankable, when we went to develop the bankable, that's united us, and we sit together. And our main goal was in accordance to because we already have that National Cancer Control Strategy 2430. I think it's a 2430. Yeah. 2430 and recent impact mission. Their recommendation, what we have brought together, and we focused on infrastructure, building design in academy, because we belongs to the earthquake prone country in the world. What should be the foundation because even if we have the small countries, we have 3 different seasons. If you go to the Himalayas, we have a very cold weather. In the middle, normal weather. In the south, towards the India, we do have a very warm tropical weather. So, and there we do have what we call different climates. So we work with engineers who design the structural engineers. So we discussed, and the maintenance part we discussed, the human research part we discussed, and where to establish which institution will upgrade and will support in terms of equipment. So we have discussed. And this training, what the IAEA technical guidance and training supported us a lot in, because of we are developing well-structured documents. So these well-structured documents, once we have not received yet, so but we already have discussed the secretaries, the ministers, and what we are planning. Once we receive the documents, so we'll sit together from all the stakeholders and we'll hand over to this, and even because now it's a wonderful time when we develop these documents. It's a right time because a lot of other private institutions they are willing to start the new radiation therapy surgery. They want to invest, and even the government is planning to open cancer institution as 7 different institutions, and we still do not have that because of the first priority of this document. Once we receive, we are going to have to request the cyclotron facility because we do not have, because we are importing FDC from India. It's very costly. So let's hope this bank document will be one of the best documents what we will have with the help of this meeting. Thank you.
Thank you so much, Dr. Adhikari, for your insights. I think you really highlighted how Nepal's example offers a really practical lesson for other countries navigating similar challenges, and underscores the importance of aligning technical priorities with financing opportunities to ensure that the projects are sustainable. So from a national planning lens, I'd like us to now turn to how regional networks are supporting capacity development. Dr. Butt represents NORI, one of our anchor centers in Pakistan. NORI plays a central role as a key anchor center under the IAEA's Rays of Hope initiative and exemplifies leadership in developing comprehensive cancer care and in supporting capacity building efforts both nationally and across the region. Now, Dr. Butt, how has NORI as an anchor center contributed to building capacity amongst cancer centers in other countries in the region?
Thank you, Mr. Rosler. Good afternoon, dear excellencies and delegates. Thank you for inviting me to contribute to this forum. And it's an honor to share our experience as an IAEA anchor center. NORI, as an IAEA anchor center, have conducted regional training courses under IAEA RCA framework. One of the regional training course was conducted in September 2023. That was on palliative radiation in brain mets and advanced head and neck cancers. There were approximately 14 candidates from 8 countries of the region. And then we have had another regional training course on safety and quality management of radiotherapy. And in this, we brought together 24 participants from 12 regional countries. So we, for the fellowship, we have fellowship programs in our institute. We have long-term fellowship programs as well as the short-term fellowship program. Talking about the long-term fellowship program, our institute is recognized for 4 years comprehensive training in radiation oncology, in diagnostic radiology, and in nuclear medicine. So we, our highest degree awarding body body, the College of Physicians and Surgeons of Pakistan. Our institute is recognized by that body. Secondly, we also have short-term training programs for the radiation oncologist, for the nuclear physicians, and for the radiologist. We have designed short-term fellowship program that are ranging from 3 weeks duration to 3 months duration, and that might be helpful for the regional countries. We have also designed some short-term training fellowship programs that's approximately 3 months fellowship programs for the technologists, for the radiology technologists, for positioning in mammography, and for the nuclear medicine technologist in PET-CT imaging. To reach a wider audience, we hosted hybrid workshops at an institute, and that were telecasted online as well as in physical training that had a physical attendance as well. One of the workshop we conducted perhaps 2 months back on imaging of head and neck cancers, and we had extensive discussion on NIRAD's reporting on head and neck cancers. And we have had an online quiz in which we have engagement of online participants. So we have had an online quiz competition in that. And then we have had another workshop that was on hybrid brachytherapy in cervical cancers. And in these two workshops, we have had 500 international participants, and we have had a live telecast of the brachytherapy technique, and that was done on brachytherapy Phantom. So we were live from the brachytherapy suite, and it was telecasted online. We also have Aspronet. Nouri is also hosting Aspronet once per month. And the most recent, it's a virtual tumor board. So we are discussing the real-time cases with cancer specialists online available, and they are discussing management of each case. And the most recent Aspronet educational session we have had on this Saturday, on 28th June. And that was on brachytherapy. That was on SFRT, in advanced inoperable malignancies as palliative treatment modality. So that's all.
Thank you very much, Dr. Butt, for highlighting all of the activities that you do in your anchor center, and how you utilize different modalities to try and reach as broad of an audience as possible. Now, just as a follow-up question, in your opinion, what kinds of training or mentorship programs have the greatest impact in the region?
So I think in our experience, the fellowship programs have had the most powerful impact because they offer hands-on training and long-term mentorship. The short 2 weeks focused fellowship for technologists like in mammography positioning and CT protocols can be incredibly effective, especially in a low resource setting. And of course, hybrid workshops have brought global experts and hundreds of learners together in one virtual space, obviously. And finally, the Aspronet, that is the virtual tumor board, is ongoing mentorship success as it connects multiple centers monthly to discuss real patient cases, share strategies, and improve practice. In summary, programs that contribute, that combine clinical exposure, technology training, and mentorship, those are the ones that truly build confidence and capacity. Thank you.
Thank you so much, Dr. Butt, for illustrating how Nouri is not only advancing cancer care in Pakistan, but also across the region, and how anchor centers like Nouri really build sustainable capacity. So this is really an essential part of the Rays of Hope vision, and we're very grateful for your continued support. Now let's explore another regional model from Southeast Asia. Dr. Krisanath Chumsamarki joins us from Thailand, a country that has emerged both as a leader in national cancer care and a strong advocate for regional collaboration. Thailand's commitment to expanding access to nuclear medicine and radiotherapy services is matched by its active role in supporting other countries through training and technical support. Now, Dr. Krisanath, Thailand is playing a critical role in both national cancer care and regional cooperation. Can you please share how international collaboration has improved access to cancer diagnosis and treatment in Thailand?
Dear Excellency, distinguished guests, ladies and gentlemen, thank you for the question, Kim, and opportunity to be one of the panelists today. So I can confidently say that international collaboration, particularly through the IAEA, has play a transformative role in advancing cancer diagnosis and treatment across our country and the region. I can elaborate this into 3 points. So the first point is about the human capacity building through the IAEA fellowship, training course, and expert mission. We had the opportunity to learn from leading expert hospitals worldwide. This experience has introduced us to cutting-edge practice in radiotherapy, nuclear medicine, and diagnostic radiology. The knowledge and skill gained aboard have been instrumental in evaluating our local standard and building confidence in implementing emerging practice. So the second point that I would to mention here is the integrating of innovative approach in real clinical practice. So the training does not stop at theoretical knowledge. It emphasizes practical in the country. So with a population of approximately 70 million, Thailand currently has nearly 60 radiotherapy centers, which includes more than 120 LINAC, offering a full range of service from conventional radiotherapy to advanced modalities such as IMRT, VMAT, and proton therapy. In nuclear medicine, there are close to 50 centers nationwide supported by 6 medical cyclotrons. To further enhance access to cancer care, we are continuously investing in infrastructure and human resource, expanding our workforce to meet growing needs across the country. So lastly, I would like to mention about expanding from the national to the regional level as the perspective of the anchor center. As an IAEA anchor center, Ramatipadi Hospital has extended this impact regionally, support capacity building in neighboring countries in the region through the workshop, hands-on training, and cooperative research project. Since signing the agreement at the IAEA General Conference in 2024, we have trained more than 40 fellows and hosted the workshop with more than 30 participants. So this activity is supported by the IAEA. So this activity, we can improve the access to the cancer diagnosis and treatment in the region.
Thank you very much, Dr. Krisanath. We touched about this at the beginning of the session, the differences in terms of capacity across the region as also being an opportunity. Now, taking this into consideration, in your opinion, considering the infrastructure differences across the region, how can regional collaboration be structured to help countries at varying stages of system development?
So that is very important question. I think to help the country with different level of infrastructure. So the first step is to identify and classify the current level of cancer services and specific need. So for example, whether they are just starting the service or already providing the advanced therapy. So once we understand that, we can match them with the right kind of support, so such as the training or expert visit. The country with more advanced system, like those with the anchor center, so we can mentor and support others through training program or hosting the workshop together. So this kind of structure, regional collaboration allow each country to go based on its own pace and context, while we still being part of a shared effort to improve the cancer care across the region.
Thank you so much. Really, your insights highlight how regional collaboration can be structured in a flexible and scalable way to ensure that no country is left behind in our quest to ensure cancer care for all. So thank you for that. Now, as our time is nearly up, please allow me some brief closing remarks. As we conclude today's panel, I would like to sincerely thank our distinguished speakers for their valuable time and their insights, as well as sharing with us concrete experiences from across the region. What we've heard today reinforces a clear message. Bridging the cancer care gap requires coordinated action across multiple levels, national, regional, as well as international. From strategic donor engagement and flexible financing to national planning and the vital role of anchor centers, we've seen how partnerships can drive meaningful progress even in most resource-constrained settings. From my side, three key takeaways emerge. Multi-level cooperation, including North-South, South-South, and triangular, is really not just an option, it's absolutely critical to ensure the sustainability of our cancer care programs. Second, investment in human resources and infrastructure must go hand in hand, ensuring that new equipment is matched by trained professionals utilizing them. And third, education, innovation, and regional solidarity are central to sustainable impact in cancer care. In terms of funding priorities in the region, the focus remains on expanding equitable access to essential services, particularly for LDCs and SIDS. Regional needs focus on scaling radiotherapy and diagnostic capacity, investing in human resources development through structured training and education programs, as well as supporting the development and implementation of national cancer control plans. Strengthening regional coordination through anchor centers, South-South, and triangular cooperation is also critical to fostering sustainable, resilient cancer care systems that leave no one behind. So as we move forward, the Rays of Hope initiative provides a strong framework to guide and amplify these efforts. Thank you all once again to our distinguished panel, and of course to our gracious hosts as well, for sharing your knowledge and experience, and to all of you in the audience for your participation. Let's continue working together to ensure no one is left behind in the fight against cancer. Thank you all.
Pictures. Thank you very much. Thank you, Kim. It was a very nice presentation and recap. Now we'll go to the last session or the last panel of the summit. So this last panel focus on the on the cancer. So Rays of Hope and breast cancer. So this session will be moderated by Ms. Lisa Stevens, Director, the Programs of Action for Cancer Therapy, IAEA. So Lisa, the stage is yours.
Great, thank you so much, Lalisa. So Excellencies, dear participants, we're coming to the end of the forum, and for this next 45 minutes, we want to take a thematic approach to our discussion. Breast cancer is the most diagnosed cancer and leading cause of cancer-related deaths among women worldwide, with over 2.3 million new cases and 670,000 deaths just in 2022. While early detection significantly improves survival, women in low and middle income countries face major barriers to accessing essential imaging services due to limited equipment, trained personnel, and quality systems. The aim of this session is to talk about progress in breast cancer detection and management
and hear examples from countries who have benefited under Rays of Hope. We also welcome the perspective of our partners on increasing ways we can engage to address the growing breast cancer burden. We also have a unique take in this final panel of our day. I'm delighted to introduce Ms. Suwera Deju, a breast cancer survivor and member of the Nagat Breast Cancer Support Group. She will give us the perspective of the lived experience and the importance of increasing early detection of breast cancer. Ms. Suwera will speak in Amharic, and her remarks will be translated by Dr. Sarah, a general practitioner and volunteer at the Nagat Breast Cancer Support Group. So if you go ahead and if you don't speak Amharic, if you go ahead and put on your ear devices, you'll be able to hear the translation. So now I please invite Ms. Deju to share her story.
እንዴት ዋላችሁ? በቅድሚያ ወደዚህ ስብሰባ ስለተጋበዝን በንጋት ጥቁር አንበሳ የጡት ካንሰር ሳፖርት ግሩፕና በመላው የጡት ካንሰር ተጠቂ ስም እናመሰግናለን። በመቀጠል በመቀጠል ስሜ ስዌር ደጁ እባላለሁ። እድሜ 32 ነው። ባለትዳርና የአንድ ልጅ እናት ነኝ። የምኖረውም እዚሁ አዲስ አበባ ነው እና የካንሰር ጡት ተጠቂ ነኝ። ከዛም በላይ ደግሞ በጣም ጎበዝ ጀግና ካንሰርን እያሸነፍኩ ምኖር ወጣት እናት ብዬ ነው ራሴን የምገልጸው። ካንሰሩን ያወቅኩት እንደ ኢትዮጵያን አቆጣጠር በ2015 ታህሳስ ወር ነበረ። በሰዓቱ በጣም ትንሽ ነበረች። ሕክምና ሲሄድ ያው ጤና ጣቢያ ነበር የሄድኩት። እዛ ሲሄድ አልትራሳውንድ አዘዙልኝ። በአልትራሳውንድ እጢ ነገር ይታያል። እጢ ነገር ይታያል ግን ሴቶች ላይ በብዛት ስለሚከሰት ይጠፋል ብለውኝ ያው ደስ ብሎኝ ወደ ቤት የተመለስኩ ነኝ። ይሄ ሲሆን መስከረም ወር ነበረ። ከዛ እያለ እየቀጠለ ይሄ ሲሆን መስከረም ወር ነበረና እየቀጠለ በ3 ወራ እስከ ታህሳስ ድረስ በጣም ሳይዙ ጨመረና ተለቀ። ከዛ ተመልሼ ሄድኩኝ ደግሞ ወደዛ ጤና ጣቢያ ሄድኩኝ። ከዚህ በፊት መተሽ ነበርኩ እንደዚህ ብለንሻል ይተውሻል አሉኝ። ቢተወኝ እስካሁን ይተወኝ ነበርና ግን እየጨመረ ነው። ጭራሽ ወይ ካልሆነ ሪፈር ጻፍልኝ አልኩት። ሪፈር ጻፈልኝ። ሪፈርን ይዤ ወደ ሆስፒታል ሄድኩኝ። ሆስፒታል ሲሄድ ያው ሲያዩኝ በጣም ተደናገጡ። እድሜንም ጠየቁኝ። በሰዓቱ 30ም አልሞላኝም ነበር። በቤተሰብም አለ ወይ ብሎ ጠየቁኝ። በቤተሰብም አልነበረም። በቃ እስኪ ለማንኛውም ወይ ምርመራ እናርግ አሉኝና ምርመራዎች ተደረጉ። አልትራሳውንድና ኤክስሬይ ናሙናም ወሰዱ። ከዛ ናሙና ላይ የተወሰነ ያሳያል። ስለዚህ በቃ ወይ በቃ ያለው ነገር መቆረጥ ነው አሉኝ። በቃ ተደናገጥኩ። በሰዓቱ በጣም ደነገጥኩ። ተላቀስን። ከባለቤቴ ጋር ብቻ ነበርን። ልጄም ትንሽ ነበረ በሰዓቱ። ያው እንደምንም አሳመን። እንደውም እድለኞች ናችሁ፣ ምርመራው ሕክምናውም እዚህ ነው ያለ እንደ በፊቱ አይደለምና እዚህ ማድረግ ትችያለሽ ሁሉ ምናምን አሉኝ። እሺ ብዬ ተስማማውኝ። ከዛ ግን መልሶ ወይ ዝም ብለን ሁሉ ከምንቆርጠው ለምን የተወሰነ እጢ ሆነ ወጥቶ ተመርምሮ አይተን አይቆረጥም አሉኝ። እሺ አልኳቸው። እንደዛም ተስማማውኝ። እጢዋን ወጥታ ተመርምራ ስትመጣ ያው በቃ እርግጠኛ ለመሆን ነው እንጂ እንደዛ ነው ተባልኩኝ። እሺ ብዬ ሙሉ ለሙሉ ተቆረጥኩኝ። ተቆርጬ ከዛ ያው በ15 ቀን ደረቀልኝ። ተመልሼ መጣሁኝ። ተመልሼ መጥቼ ኬሞ 8 ዙር ወሰድኩኝ። ያው ኬሞ ላይ በጣም ከባድ ነበረ። ኬሞ የራሱ ህመም አለው፣ በጣም ከባድ ነው። ግን ያው እንደምንም አለፍኩት። ልጄም ስለሚያጓጓኝ የነበረ እንድኖርለት ስለምፈልግ የነበረ የኬሞን ሂደትም አለፍኩት። በቃ ባለቤቴም ያበረታኝ ነበር በሰዓቱ። አለፍኩት። ያው 8 ዙር ወስጄ ከዛ የነበርኩበት ሆስፒታል ጨረር ስለሌለ ወደ ወደ ጥቁር አንበሳ ተላኩኝ ማለት ነው። ከዛ ጥቁር አንበሳ ያው በውጭ ስሰማ በጣም ወረፋ ነው፣ ሰው ብዙ ነው ያለ፣ ብዙ ታማሚ ነው ያለ ነበር የምባለው እና ያው ወረፋውም ቢያንስ ከአንድ ዓመት በላይ ያስጠብቃል ነበር የምሰማው። በእርግጥም ሲሄድም እንደዛ ሆነ። ብዙ ሰው ነው የነበረ፣ በጣም ብዙ ክፍሉ በጣም በቃ በዊልቸር መሄድ አለ፣ ጠረጴዛ ላይ የተኛለ፣ ብዙ ስቃይ ነው የሚታየው፣ ጨረርን ጥበቃ ማለት ነው። እና እኔም እንደማንም ሰው አስጠበቅኩኝ ጨረሬን። ከዛ በቃ ይደወልልሻል ተጠባበቂ ተባልኩኝ። እኔ እንደዛ ተብዬ ግን ቁጭ አላልኩም ቤቴ፣ ምክንያቱም ህፃን ልጅ አለኝ፣ ባለቤቴም ከኔ ጋር እየተንከራተተ ነው እና በቀን በቀን ነበር የምንመላለሰው ጥቁር አንበሳ። በቃ ዶክተሮቹም ነርሶቹም በቃ ስልችት ታረኳቸው እየተመላለስኩ፣ ቢያንስ እንኳን ክፍተት ተገኝቶ ቢያስገቡኝ ቢያስጀምሩኝ እያልኩ በጣም ነበር የምመላለሰው። ያው በመሀል በምልልስ በአመት ከ4 ወሬ እንደ ድንገት ያው ክፍተት ተገኘ፣ ጀመርኩ። የተወሰነ እንደሄድኩ ማሽኑ ተበላሸ፣ አቆምኩ ደግሞ መልሼ። ያው ማሽኑ ተበላሸ ማለት ዶክተሮቹ ሲነግሩን ጨረር መቋረጥ የለበትም ነው የሚባለው። ግን በቃ አቋረጥኩ፣ ምንም አማራጭ ስለነበረኝ። ከዛ ሲሰራ ደግሞ በሳምንቱ ተደወለልኝ፣ ሄድኩኝ፣ ወሰድኩኝ። አሁንም ግን በወስድም በጣም በቃ ስጋት ላይ ነኝ። ምክንያቱም በሰዓቱ አልጨረስኩም፣ ዶክተሮቹ ባሉኝ አልጨረስኩም፣ ባሰብኩት አልጨረስኩም እና አሁንም ይመለስ ይሆናል ወይ እያልኩ በጣም ስጋት ውስጥ ነኝ እና ከዛ ሀሳቤን በቃ ሳጠቃልል ማለት ነው፣ በጣም ሀሳቤን ሳጠቃልል በመጨረሻ ላይ በመሰረቱ ቅድመ ልየታ ተስፋፍቶና ተጠናክሮ ባለመደረግ ቢደረግ እዚህ ደረጃ አይደርስም ነበር ካንሰር በራሱ መጀመሪያ። ይሄ የማይደረግበት ምክንያት ደግሞ በቂ የመመርመሪያ ማሽን ስለሌለን ነው። ለምሳሌ ማሞግራፊ ብዛት ስለሌለን ነው። ስለዚህ የማሞግራፊ ማሽን ድጋፍ ቢደረግልን የእናቶች ሞትና ስቃይ እንቀንሳለን። ሁለተኛ መልእክቴ ደግሞ ጨረር ማሽን እየተስፋፋ ቢሆንም ግን ባለው ታካሚ አንጻር በቂ አይደለም። ጨረር ሕክምና ለማግኘት ብዙ እናቶች፣ አባቶች፣ እህቶች እና ህፃናቶች እየተሰቃዩ ነው። በመሀልም እየሞቱብን ነው። ስለዚህ ይሄ ሁሉ ስቃይና መከራን ለመቀነስ የጨረር ማሽን የግድ ድጋፍ ያስፈልገናል። ብዙ ለውጥ ድጋፍ ቢደረግ ብዙ ለውጥና ብዙ ህይወት እናድናለን። ሞትና ስቃይ ይቀንሳል። ስለዚህ ያው ጨረር ማሽን እንደምንም ያው ድጋፍ ቢደረግ ነው እኔ ሀሳቤ። ይሄ ሁሉ ስቃይ ያለ፣ ይሄ ሁሉ እንግልት ያለ እንዲቀንስ እንደዛ ነው ማለት ነው። አመሰግናለሁ።
So thank you very much, Ms. Deju, for sharing your experience and really reminding us why we're here today, so that we have more outcomes like yours, and also with your call to action, not only for increased screening, which we'll talk a lot about in this session, but also access to treatment. So now we have our panelists who have different perspectives that they're going to share with us today. Our first panelist is Mr. Luis Longoria, Director of IAEA's Division of Latin America and the Caribbean. You've seen him already earlier today. Luis is going to discuss efforts that are already underway to increase access to mammography in his region. And he's also going to share the experience of Brazil. We had a panelist plan to join us from Brazil and talk specifically about what they're doing, but Dr. Beltrami was unable to come due to a family issue. So please, Luis, talk broadly about the Latin America and what we're already doing, and then share a few minutes specifically on Brazil.
Thank you very much. Well, under the Race of Hope initiative, we started a project in diagnostics of cancer and with mammography units. At the start of the project, we were trying to, like, country by country, but in the end, we wanted to be a bit more ambitious and decided that we wanted to do it regionally. So we created a project to include 20 countries in Latin America and the Caribbean. And the project consisted in getting nearly 50 mammography units to be able to really touch a little bit on the problem of cancer in Latin America. We were able to raise the necessary funds, extra budgetary funds, and luckily the United States agreed to support our project and gave us a large amount of money that, together with some of the money that we already had, were able to buy all this equipment. The idea also was trying to designate these mammography units in those areas and those cities that were far from the urban centers. In almost all Latin American and Caribbean countries, the cancer care is concentrated in the capital, in the big urban cities. So we were trying to get them out of those, and we found that all countries had this problem, how to get access, that it was not 500 miles from the center of the country or where the mammography unit was. And we were successful in as much as that we are currently about 85% of the units have already been delivered to the countries. And slowly we are commissioning them, installing them, and we're going to go to the next phase, that is the training of the people that are going to be using this mammography unit. That was a good project that we are in the middle of, and we just want to say that it's possible to do at this level. Now, in the coming months, we're going to replicate this to try to reach those smaller cities, those towns that they don't have, but they have enough patients to arrive. Many times the screenings are not done, not because the person doesn't want to go or because the equipment, something. It's because there isn't one in the near place, you know, and that's what we want to do. Now, as I say, the next challenge is to train the people that are going to operate this, because not everybody has this capacity building. Now, I've been asked to share a story regarding Brazil. In Brazil, the Brazilian Navy has a group of 3 ships. These are unique hospital ships that they go along the Amazon River. They take about 3 months to travel all the way up and down, touching several countries. For many of these people that live in the areas near the river, is the only time that they can have access to a kind of mobile hospital. In these ships, they can have eye treatment, X-ray, they can have ears, and so on and so forth. But they didn't have mammography units. They couldn't be screened. So what happened to somebody who lived 1,000 miles to the nearest mammography place? Nothing, because there wasn't one. So together, the Brazilian Navy and us, we provided the mammography units for 2 of those ships. And I can report that these ships have installed the mammography units and currently stopping, as I say, they go to Peru, Ecuador. But really, it doesn't matter the nationality. What is important that is at least there's hope of a screening in these particular places where there are no hospitals, there are no medical rooms, there are no specialists. And it's a very good way of reaching those populations with little or no places to go to. So I would like just to share that story of Brazil. Thank you.
Wonderful. Thank you very much, Luis, for highlighting how these new mammography equipment will have an impact in Latin America, and also sharing the specific and unique way that Brazil is reaching those that are far away from population centers. So I now want to turn to the African context. The Africa division at IAEA has recently received funds to support mammography and other breast cancer-related activities from the Japanese government through TCAD. And I would like to introduce now Dr. Ignatius Winibuno, the Chief Program Officer at the Ministry of Health of Ghana, to take the floor and discuss partnerships to improve breast cancer outcomes in Ghana. So please, Ignatius.
Thank you very much, Lisa. I want to thank Your Excellencies and the distinguished delegates for the opportunity to share a few thoughts with you. It's a great honor that we've been invited to this forum, the Race of Hope Forum, a gathering of shared vision and global commitment, defining how we can together defeat cancer in a spirit of partnership, solidarity, science, and equity. On behalf of the government of Ghana and the people of Ghana, I bring you warm greetings. And I thank you for the opportunity to share Ghana's compelling experience of partnership in cancer care space. Our experience is a story of hope, resilience, and progress, a story that illustrates how bold innovation, purposeful collaboration, and strategic investments can drive meaningful changes in the breast cancer control space across Africa. Ghana is a population of about 32 million people, and I want to join our other countries, Nigeria, Kenya, and Ethiopia, who share their stories here already, to elaborate a little about what is happening in Ghana. Breast cancer is still a problem in Ghana among women. It accounts for about 1/3 of the cancers among females. And also approximately 4,500 cancer cases are reported. 50% mortality is also recorded in Ghana among these subjects. Ghana, the government of Ghana has taken the issues of cancer very, very seriously, to the extent that it has a cancer strategy and control plan. We've also established an NCD policy. We've also established a steering committee for the NCD, under which there's a subject matter committee, expert committee for cancers, and especially adult and childhood cancers are both recognized under this arrangement. Under this arrangement, the aspects of partnership is cardinal and very important, and the government has acknowledged it, but has not also reneged on its effort and its leadership role as a government, and ensuring that we have domestic and local funding to support this. Ghana currently has what's called the National Health Insurance Scheme that ensures that 95% of diseases that are coming up in the country are covered and paid for free by the government. Everything you buy in Ghana has a tax that is used to solve this particular problem. And therefore, under this scheme, you have issues of breast cancer also covered fully. Certain childhood cancers, the retinoblastomas and other cancers are also covered under this particular scheme. In fact, the story of Ghana in terms of partnership cannot be written without the role of the IAEA that served as the first point of support for us in initiating our first cancer facilities in the country for many years. And therefore, we see the aspect related to Race of Hope as an opportunity to further expand this partnership. The progress that has been made, that we've achieved so far, has not been done alone. we want to acknowledge the contributions of key partners like the IAEA, the GIZ, the WHO, World Child Cancer, the St. Jude Children's Research Hospital, as well as other local partners like the Breast Cancer International and the Cancer Society of Ghana. The partnership has led to a lot of benefits that has accrued to us as a nation and led to the expansion of oncology infrastructure, skill transfer, capacity building, and development of protocols for the management of our cancer cases. We've had over 90 healthcare workers benefiting from this kind of support, training through our colleges, College of Physicians and Surgeons, the College of Pharmacy, the nursing and midwives that have been centers for collaboration in terms of this particular training. The Konfano Teaching Hospital, in collaboration with the Mayo Clinic, has also resulted in a lot of our professionals being trained. Furthermore, NGOs have also played a very critical role. We have explored the role of community leaders like our chiefs and prominent kings, our schools, and other community engagement approaches to drive the awareness of cancer among the community. Ghana wishes to acknowledge the catalytic importance and role of the IAEA in improving cancer care in Ghana, specifically the support they've given the Ghana Atomic Energy and the Radiotherapy Center at the Kolebu Teaching Hospital and the Konfano Teaching Hospital. We know that we can take this collaboration further by expanding it to other areas like the Tamale, which is the northern part of Ghana that does not have a radiotherapy center, the Cape Coast Teaching Hospital, and the whole teaching hospital, which we are looking at to further under the Race of Hope project. We want to let us know that aside all this important collaboration, it is not possible that we could have done it alone. And we think there are still other areas of collaboration we can explore. One, in expanding our cancer registry, which we think is very important. We have facility registries, but we want to expand at the national level, a national cancer registry. We want to see how we can expand access to medicines, even among our children, and also capacity building using our postgraduate colleges that have been established by law. The lessons I want to conclude is that any meaningful partnership must be a sustainable partnership, not just partnership in the name of partnership, but a partnership that is driven by effective leadership and effective coordination. Because there are many multi-stakeholder groups in every partnership, and if you don't take time, each of them advances their own interests. So there's a need for coordination. This is what Ghana has done all along. There's also a need for us to express our national priorities clearly, so that any stakeholder who comes or interest group who comes is aligned to that particular agenda. There's also a need for us to operate in an honest, transparent manner and keep commitments to the particular agreement that we make. And this is very, very crucial. And I think there's a need to, if we want to succeed, we must involve the community. Without it, we cannot succeed. Finally, I want us to ensure that without mechanism for ensuring we have local mobilization of resources, we'll just leave the partnership to just people who are coming in and the government will not have any role. This is not sustainable. And finally, we must have a partnership that sees the partners committed to having a desire to save lives and livelihoods, to restore the human dignity of people who are affected and improve the overall national development of the countries and the people that we work for. I want to believe that together we are not just treating cancer, we are restoring dignity, saving the futures of people who are affected, lighting the way for a healthier Africa. We are hopeful that Ghana's experience is a compelling example for African resilience, innovation, and will inspire continental movement towards breast health equity in Africa. Perhaps the most important is that this will amplify the momentum and move us towards a better Africa. where cancer is under control. I want to thank you for the opportunity to have shared a few thoughts. Thank you.
Great. Thank you so much, Dr. Owenibuno. I think you've summarized many of the panels that we've heard from throughout these 2 days. So I really thank you for your remarks specifically on partnerships. And now I want to turn to two partners who have agreed to participate in the panel and share their experience and offer ideas on enhancing collaboration to improve early detection and early treatment of breast cancer. So our next panelist is Dr. Miriam Mutebi, President of the African Organization for Research and Training in Cancer, and also a consultant breast cancer oncologist, assistant professor in the Department of Surgery at the Aga Khan University Hospital in Kenya. So Miriam, could you talk a little bit about how Aortic can partner under Rays of Hope to support capacity building in Africa to support the delivery of care for breast cancer?
Thank you, Lisa. And I really want to start by just acknowledging Ms. Deju's incredibly powerful and grounding sentiments around why we're here and really why we do what we do. The other thing I really want to perhaps reflect on is with Aortic, which is the largest and I would say oldest continental body, bringing together multi-stakeholder partners as along the cancer continuum, as Dr. Ignatius mentioned, really bringing and honing in the need to ensure that we're pulling together in the same direction. And how we've managed to ensure this is by really trying to keep a patient-focused approach, a patient-centered approach. What we do know in my practice, both clinically and from a health systems perspective, is that despite the efforts that we've been having for the last couple of years and the incredible efforts that we're hearing from all these different countries, the majority of our patients are still getting diagnosed with advanced disease and often not completing their care. And if we do a deeper dive into some of the reasons which Ms. Deju has eloquently outlined, we again see, one, the need for education, one, not just first in the communities, actually having awareness of breast cancers, and actually trying to look at how do we modify health-seeking behavior. The second broad barrier is really around the healthcare workers, where we know on average in sub-Saharan Africa, patients are seeing 4 to 6 healthcare providers before definitive diagnosis of their cancer is made. And so part of the work that we've been doing at Aortic is really trying to get in at the gatekeeper level, where we're engaging with community health workers, working with our partners to not just identify so that primary healthcare providers know the common signs and symptoms of healthcare, of common cancers, which are high burden cancers in our region, but also knowing what are their local referral patterns and how we can ensure that these patients are navigated to ensure their care. Beyond that, once we get to the health system, we find that, either due to lack of equipment or due to available infrastructure of the workforce, patients are sometimes getting suboptimal treatment or the wrong treatments. We're having patients, for instance, getting, mastectomies, depending on who you see first. You have a surgeon and they get surgery first rather than having multidisciplinary discussions. And so really looking at some of the work that we're doing, one, enhancing or ensuring that the communities of practice are equal, such that whether you're getting surgery in Kenya, Tanzania, or Nigeria, it's essentially the same. Again, the same applies to radiation services, ensuring that we are homogenizing treatment, whether it's looking at, we're having different stages of transition in different countries. So looking at things like, we've just had a course where we're training our radiation oncologists to transition from 2D to 3D, which is really applicable as we start to expand these services. As we think about, early detection and mammography, sometimes one of the things that we also have to look at is what are the innovations and strategies that work for our setting. We're not necessarily going to have mammography screening in all the countries, but really looking at what are some of the early detection strategies, whether it's clinical breast exam, how do we homogenize that, and how do we incorporate it and inculcate that into strategies that are really going to expand care for our patients. The other thing we do need to think about, of course, is research and development. We are talking about the need for data, but we can't really describe at any length any of our regional data. We do know that many of the clinical trials that we are using as a basis for our guidelines have been predominantly
are taken from populations in the West. And so part of the work that we've been doing over the last 2 days through our Best of ASCO Africa conference that we had was really trying to look at the data, consolidate that, and look at how does this apply to our patients and how do we contextualize this for our setting. But more importantly, how do we set up frameworks that are actually able to not only consolidate but harness and use this data for good. Now, I think the last aspect that we may want to think about, and this I think would be an incredibly exciting opportunity for us to think about collectively, is the activism and policy. Because sometimes we think about, we're all talking to ourselves as, as an oncology workforce, but there really is the need to, one, develop I would say, nuanced policy that, especially around asking our civil society organizations and how to ask policymakers for funding. We're saying that without funding, and local funding specifically, we don't have any sustainable options. And so part of the work that AORTIC has been doing is really trying to harness and train our civil society organizations on how they can effectively engage with governments, engage with researchers, engage with communities. And last but certainly not least is really bringing it back we've talked about community. I think we need to talk about culture. There's still a lot of stigma and collectivism that exists around a cancer diagnosis. And so part of the strategies that we've been doing is working with not just, oncologists, but anthropologists to change even the language of cancer. We're talking about expanding access, but we're telling patients, listen, you're going to come in, we're going to mash, we're going to squash your breast. And then if we find something, we chop it off, and then we're going to burn the area. And you're wondering why we don't have a long queue signing up for these services. So it's really thinking through, and these are some of the strategies we're working on through AORTIC around changing the language around cancer, changing messages of hope, mobilizing civil society organizations such that we can ultimately make a difference for our sisters, mothers, and daughters. Thanks.
Great. Thank you so much, Miriam, for those points for all of us to think about in terms of, engaging the wider community and really that activism and moving into policy. So our final panelist is Dr. Susanna Stanway, co-organizer of the London Global Cancer Week and honorary consultant medical oncologist at the Royal Marsden Hospital in the UK. So Susie, can you please talk to us about how we might leverage London Global Cancer Week to increase the impact?
Thank you very much, Lisa, and thank you very much for the invitation to speak today. This meeting's been inspiring, educational, and opportunity-making in equal measure. So we've heard the statistics about global breast cancer, but this is really stark. 1 person every 14 seconds somewhere in the world is diagnosed with breast cancer, and 1 person every minute somewhere in the world dies of breast cancer. And yet the chances of survival are dependent on education, wealth, and geography. And furthermore, we want women to survive with good quality of life. There are 7.8 million women living globally who have been diagnosed with breast cancer in the last 5 years. And between 2020 and 2040, Africa is going to have the largest percentage increase in breast cancer cases than any other continent. I think it would be remiss of me not to just briefly mention the Global Breast Cancer Initiative Implementation Framework and its 3 pillars from the WHO, that of health promotion, with the key performance indicator of over 60% of women diagnosed at stage 1 or 2, timely diagnostics with imaging and sampling within 60 days, and comprehensive breast cancer management with over 80% of women receiving multimodality treatment without abandonment. So there are many international meetings presenting wonderful new treatments for breast cancer, which are hugely necessary and push the specialty forward. But I think we are all in agreement that the real metric of success for the cancer community and people affected by breast cancer will be when women diagnosed with breast cancer, no matter where they live, their level of education, their wealth, present with early stage disease and have access to timely, evidence-based, quality cancer care of value, and we mustn't rest until this is the case. So we can collaborate individually within our institutions, But in the UK, a group of us that were collaborating internationally realised in 2016 that we could perhaps leverage the impact that we all have globally if we come together. And we launched London Global Cancer Week in 2019. So this is now in its 7th year, and it's an annual federated multidisciplinary series of events in November that we hold, which aim to act as a catalyst to improve cancer outcomes globally through multi-sectoral engagement. We run it as a non-profit. We have a robust governance structure, 14-strong international steering group, of which Miriam is one, and a small management group that implement this. And we have some unrestricted support from a few generous donors. We want to encourage collaboration, we want to raise awareness, and we want to convene international leaders. We want to push the issue of global cancer control up the global development agenda. We want to offer actors in low and middle income countries equitable and accessible platforms for highlighting cancer initiatives that are happening, encourage coherence in policy making at national and international levels by providing space for holistic discussions, and present programmes that highlight progress being made around the world, appreciating that context-specific approaches are really what this is all about. And we want to act as a catalyst. So our unique selling points of London Global Cancer Week are that it's free to present at, it's free to attend. Many of the meetings are virtual because we appreciate that in many parts of the world it's difficult to get travel visas. And we want the meetings to span the continuum of care, and to cross-cut different disciplines, for example, global security challenges. So address the challenges of implementing cancer care in countries in conflict, for example, or where climate change is affecting delivery of cancer care. We want it to be international. We've had over 150 countries attend or participate in historic London Global Cancer Weeks, and all of the meetings are hosted on our website and are free to access retrospectively. We don't just want to be a talk shop, we want what we talk about to be translated into action. And I'm pleased to say that London Global Cancer Week has hosted nascent discussions which have resulted in World Radiotherapy Awareness Day, which we had the QR code for up here earlier, and also for a Lancet series about cancer in the Commonwealth. We've hosted an annual Inequalities Day and Inequities Day, which is run by Dr. Olubukola Ayodele, who trained in Nigeria, which was hosted in our Houses of Parliament. And we've strengthened global collaborations that we have with the SARC Federation of Oncologists, with the China Anti-Cancer Association, with the Aortic and the Canadian Global Oncology Group and beyond. And we'd like to continue to contribute to broader discussions such as the high-level meeting on NCDs coming up at the UN in September. And we've established the Vanessa Moss Prize, which rewards junior oncologists, such as the recent winner, who is an Ethiopian oncologist, Dr. Gebrekirtos Hagos. We'd like to do all that we can to garner high-level support, and we thank WHO Director General Tedros and Commonwealth Secretary General Baroness Scotland for their messages of support last year. We want to stand united so that all women, irrespective of geography, wealth or education, have equitable access to quality, evidence-based cancer care across the continuum that's of value. Thank you very much for your support of London Global Cancer Week and for the opportunity to present today. And thank you very much to the African Union, the Government of Ethiopia and the IAEA for generously hosting us.
Great, thank you so much. I hope that if you didn't know about the African Organization for Research and Training in Cancer or London Global Cancer Week before this session, you've learned about additional opportunities, but not only specific to breast cancer, but including how these organizations can support the breast cancer early diagnosis and early treatment. I would like to turn to the floor for one intervention from one of our strategic partners, GE Healthcare. So Chris, please.
Lisa, thank you. Esteemed panelists, thank you very much. I'd just like to echo the spirit of partnership that I've just heard from both of the colleagues here, Ms. Stanway and Ms. Mutebi. I think we've had the great privilege of installing a lot of mammography machines around the continent, and the installation of a mammography machine does not equal cancer care. I think the real true partnership of education, training, good protocol development, good safety development is absolutely critical. We've done a lot of work in sub-Saharan Africa, and I think it's the Rays of Hope Forum is probably the largest event we've seen where there's a real hope for improving cancer care. We've all heard about the nightmare of equipment being delivered, and not being used or not being used successfully. Within sub-Saharan Africa, I think education is so critical. Women, as you have both eloquently stated, are turning up with stage 3 and stage 4 cancers. We've got to stop that. It's just unacceptable. So I think, G Healthcare is a very proud partner of the Rays of Hope. We're announcing the donation of a mammography machine to the Dosimetry Centre at the International Atomic Energy Agency, and that's going to be for the use of safe protocols, safe training, and a whole variety of other things. And there'll be more to follow in that later, but with the partnership of Lisa and Dr. May, we're working together with true partnership. There's no one company, agency, or multilateral that actually do this. So I think the theme of partnership is critical, and we're going to remain true partners to the agency. Thank you, Lisa. Thank you, Dr. May.
Great. So I want to provide a sincere thanks to all of the panelists for their contributions, and I want to echo what Miriam said for Ms. Deju for really grounding us and reminding us of why we're here and why we particularly wanted to focus on breast cancer and have the voice of the patient. We heard that there are still areas that need attention: funding, training, equipment, advocacy, engaging with policymakers, engaging with tribal chiefs and government leaders. We are soon going to launch the breast cancer funding proposal that we hope will continue to enhance global access to breast imaging services in order to promote early detection of breast cancer. Similar to the funds that Luis described and that I mentioned have been applied in the African context, future funds mobilized under this proposal can be applied in each of our 4 regions, and you've heard from all of the regions at IAEA today. So similar to these US and Japanese funds that have already supported Latin America and Africa respectively, we want to ensure that early diagnosis services for breast cancer are available to more individuals globally. The budget for this specific proposal is nearly 30 million euros, and we do hope that there are partners out there who we can engage to support this expansion of services. So if you want more information about this, once the proposal is cleared, we're happy to share it with you if you connect with any of the IAEA staff that are here or that you regularly engage with. So we're going to move into our closing session, but please first join me in thanking not only our keynote speaker, but also all of the panelists for sharing here today. Please, a round of applause. And after our photo, we will move into the closing.
Thank you very much, all the panelists. The panel was really, as previous panels, we learned a lot from each. So hopefully we will compile the lesson learned from this meeting and share among each other. And also we have witnessed most participants were exchanging address, ideas, intercontinental experience sharing. Those all things are the main purpose of this meeting. So the best experiences from the other continent should go to the other one. And also the collaboration between continents and between countries are the one that we always aspire, and that is a very good one. So that is what we have seen. Hopefully, everyone was happy in this meeting, and yeah, I was informally collecting some information, and most of you, I asked, are almost all of you were happy. And if there is different idea who was not happy, any thing happened, can share the idea, raising the hands to just further correct if anything happened. I can give the floor. Otherwise, yeah, every good thing has an end. So we liked our meeting, but it is coming to an end. So just to finalize our meeting, we will have a closing remark from IAEA and from the Federal Ministry of Health, Ethiopia. So Dr. Makdas is at the gate. She's coming to close, and yeah. Welcome, Your Excellency, Minister Makdas. And now we'll, without further ado, we'll go to the closing remark. Mr. Gashau from IAEA Africa Director will come and do his closing remarks.
Excellency Dr. Makdas Daba Faisa, Minister of Health of Federal Democratic Republic of Ethiopia. Excellencies, Ministers, distinguished guests, ladies and gentlemen, all protocols observed. As this two-day forum comes to an end, I thank you for the valuable updates on progress, for sharing your experiences and underscoring your commitment to improving access to cancer care. I want to thank everyone who has participated in this important event over the last 2 days. On behalf of our Director General, Mr. Rafael Mariano Grossi, I would like to extend my deep gratitude to the Ministry of Health, the Ministry of Foreign Affairs, and the Ministry of Innovation and Technology of the Federal Democratic Republic of Ethiopia, and other key contributing and support institutions and their respective senior leadership for the dedication and unreserved support in hosting this event and seamlessly organizing all the details, including the logistics in Addis Ababa, the diplomatic hub of Africa, and the birthplace of Race of Hope. I thank the African Union Commission for availing to us this magnificent space. It has been an honor to be able to look back on the 3 years of Race of Hope progress in the same place where it was launched. Please allow me to express our deep gratitude to governments of Australia, Belgium, France, Germany, Israel, Italy, Japan, and Portugal, who were here with us during this forum. I furthermore want to express my deepest gratitude to the other partner countries that could not have the opportunity to join us in person today. The contributions to this important global initiatives are having a concrete impact on the lives of cancer patients in our member states. I also thank Algeria, India, Morocco, Pakistan, South Africa, and Thailand for joining us at the forum to talk about enabling sustainability of training and capacity building in cancer care through the establishment of anchor centers. I also want to thank the anchor centers that were not able to join us here this week in Addis Ababa, but which work tirelessly every day to support our goal of cancer care for all. I appreciate the support of the private sector. Thank you to all partners who make this happen globally. Thank you to the partners who joined us at this forum: European Investment Bank, Electa, Fujifilm, GE Healthcare, MedAccess, MedServe, OPEC Fund, and CMEL's Healthiness, and continue to strengthen their partnership with IAEA and member states. I'm also thinking of deeply and grateful to all those who join us virtually and who have supported Rays of Hope throughout the years. I am pleased to see the commitment of international financial institutions and member states in dedicating resources to cancer care. Thank you to all member states for sharing among us your progress and challenges, as well as lessons learned. This forum allowed a direct dialogue between different stakeholders, contributing to the Rays of Hope initiative. I know this will continue beyond this event. All of this has been possible because of you, your dedication, and your support. Thank you to the planning working group from the IAEA, the Ministry of Health, Ministry of Innovation and Technology, and Ministry of Foreign Affairs of Ethiopia, as well as the team from African Union, who have done all the details in a meticulous manner, and the result is such a successful and seamless event. Excellencies, ladies and gentlemen, throughout this forum, we have heard about the progress that has been realized, the lessons that have been learned, and outstanding challenges that remain. Continued cooperation and collaboration undoubtedly are the key for the way forward. Greater involvement of new partners is a game changer for Rays of Hope. We continue to seek strategic collaborations, engaging the private sector and international financial institutions for crucial financial support that is highly required, as well as the support of research institutions for knowledge sharing and training. During this forum, we have learned more about the important work in breast cancer, and we heard about the benefits of leveraging strategic funding documents to support resource mobilization and sustained financing for cancer care. We had the absolute honor of St. Jude Children's Research Hospital joining us for the official launch of our partnership. This partnership will bring global pediatric radiation medicine to a new level, and we look forward to work with you more. We furthermore had the honor to hear from different member states, partners, and anchor centers. I want to thank all the panelists and everyone in the audience. These last 2 days have highlighted our efforts to improve access for life-saving diagnostic and treatments to improve outcomes of cancer patients. We look forward to continuing this important work with all of you. By working together, we can ensure that access to cancer care becomes a reality for every individual facing cancer diagnosis. Thank you very much for the tireless efforts and for your commitment to turning our discussion into tangible and positive change. Thank you for your presence, optimism, and ongoing support. I would like to conclude by quoting from what has been said by our Director General, Mr. Grossi. 3 years ago, here in the land of origins, we launched Race of Hope. Today, we are bringing cancer care to countries that had none. I think that was the objective of Race of Hope. We are moving in the right direction. Now I have the pleasure to respectfully invite Honorable Dr. Excellency Dr. Mekdas Dawa, Minister of Health of Federal Democratic Republic of Ethiopia, for her closing remarks.
Your Excellencies, distinguished delegates, partners, and colleagues, it is a real privilege again to stand before you today as we are closing these 2 days of very important deliberation that we had. As we conclude this important forum, I would like to acknowledge the valuable contributions that were made by all participants. A level of engagement, of days of technical engagement that we have seen over the past 2 days is really encouraging. An alignment in political will that we have seen from member states and their presentations on what has been the lesson of the 3 years journey that we had with Race of Hope have been witnessed over the past 2 days, and it's really encouraging for us as a minister, as someone who wants to see a ray of hope in our continent, and a ray of hope in our globe. It is really encouraging, and I want to commend all who have participated in here. What has emerged from the discussions is clear. Cancer control is not a peripheral issue. It sits at the core of a sustainable development, requiring a coordinated investment. It takes an investment, it takes political commitment, and also a policy and a leadership. It needs strong health system where everyone invests and the investments are connected. We have also reaffirmed that addressing the rising cancer burden is not simply a health sector issue. It needs developmental priority to make it part of the government's agenda and governance responsibility. Hosting this forum here in Addis, where the Race of Hope was initially launched at the birthplace of it, holds a particular significance for Ethiopia. This is where the Race of Hope have initiated, first launched in the same forum, in the same venue. I want to thank the African Union and also the Commission and also all who have participated and made this a reality. That progress, however, must now accelerate. We have a lot to do in the next few years. We will be asked for prioritization. Everywhere, in every stage, especially as ministers who would be sitting in cabinet, we'll always ask to prioritize, and prioritizing cancer and the cancer care and using race as a hope is something that we want to still uplift in our agenda. We cannot afford to let the momentum stall. It is for us to take it forward, and Ethiopia has placed public health at the center of its national agenda. Our commitment to expanding access to cancer service and investing in nuclear technology for peaceful health application reflects that our broader policy objective of ensuring equity through institutions and scientific advancement is still a priority. Race of Hope is more than a program for us. It is a strategic framework of multilateral collaboration and cooperation. It has proven capability of aligning technical innovation with global solidarity. And moving forward, our focus must be on how to do more implementation, because a lot has been done and we have learned a lot over the past days. And even the last speech that you had, with 2 survivors coming here, it is lives being touched. And what do we do in the next years ahead of us when SDG is about to close, where we have to do a lot of acceleration, is also a key priority for us. Our focus must be on delivery also, with tangible results at a country level. A lot is discussed at a global level, at a regional level, but narrowing down and looking at what countries can deliver with available resource is going to be our key priority moving forward, and at a country and also at a geographical level. This is because we always say no life has to be left behind, and no one should be left behind for things that could have been prevented and where life could have been saved. No country is left behind due to capacity or geography. And we have learned this over the years. Since COVID, what did we learn? What are the things that we need to move forward in a very challenging environment globally? Let this forum mark a turning point, not just in discourse, because a lot has been discussed, but in delivery. Let us translate our shared commitment in a measurable outcome where countries and all of us commit. I want to thank all who made this possible, from the country team, from the different ministers and sectors who made their way in here, but most importantly, the team from IAEA who were here all the way, both virtually when we were discussing this from conception to this 2 days of realization, but also taking this back and digesting at the secretariat level. We want to give you another responsibility as you go back to really take the lessons taken from the 3 years to what can be done better in the years ahead. Also for us, ministers who are still with us and those who also were with us virtually, this is an opportunity for us to thank who have been here throughout this journey, because this has been a collaborative work, and we know what took a collaborative work to action that saved a life. Countries have committed to this, and we are very grateful for those who have helped Race of Hope to become a reality. It was private sector's engagement, international financial institutions, and individuals' commitment and vision that shaped the vision of Race of Hope. And we're really grateful on behalf of the government of Ethiopia, but also on behalf of those who were benefiting and lives that were saved. I want to extend my sincere gratitude to all who helped the Race of Hope and the visions of the IAEA in the health sector to be done on the ground. I also want to say thank you for the coordinating team, for the local team, our Ministry of Health staff, who have worked tirelessly. By the way, the past few days, even weeks ahead, they've been doing very meticulously to check if everything was in place. I want to thank Ministry of Foreign Affairs, Ministry of Innovation and Technology, our colleagues who sit everywhere to ensure that this forum became a reality. I also want to thank all the secretariats who helped in shaping this one, and those who assisted from all fronts, from immigration to your smooth transition to your next job tomorrow or the day after. Ethiopia is committed and Africa is prepared. It is what we want to hear, a commitment and a country and a continent which is prepared. Commitment with preparation. Let us continue to work together, which I'm sure we will take this forward with clarity, consistency, and resolve. And I wish you all a very pleasant journey when you go back home, and a safe travel on your way home, and extend our deepest thank you to all who let you come here over the past 2 days, keeping your family wild, or your pets, anyone who was really watching over your things when you are here. So extend our sincere gratitude. I thank you all. Thank you.
Thank you very much. Now we will have, for the finalists, we will have a group picture outside. We started a little bit more in number than this one, but the finalists will get this opportunity. Yes. Yes,
Yeah, excuse me. For the TC participants from Africa, I can